Morning, ladies and gentlemen. Yeah, we are many in the room. Good morning, ladies and gentlemen. All right, thank you so much for honoring our invitation this morning. All right, so before we even delve into the opening prayer, introduce ourselves, there's a short video we want to watch just to awaken our minds, and we should be abreast with the reason why we are here, basically. So let's make time, watch this brief video. After, we'll commence with the main program. Thank you very much. All right. That was a quick one there from my boss. I have some few observations from the video. I don't know about you, but it gives us a background of what is expected this morning from all of us. And by way of introduction, let me invite my colleague Winston to give us the opening prayer, after which we will delve into the main event proper. Winston Deladem Gamo.
At this point, I'm the pastor here, so please, you have to clap better. Yeah. Please, shall we on our feet? Yes, we are on our feet. So we pray. Father, we thank you this morning for a time like this that you've made it possible for us to deliberate on issues concerning our health and that of every Ghanaian. We pray that you come and reside with us and abide with us as we deliberate on these issues. Guide us through wisdom, the best knowledge, the best practices. That at the end of these deliberations, out of it will come policies, deliberations. Out of it will come significant measures that can help us improve the health of each and every Ghanaian. We thank you in Jesus' name. Amen.
Thank you very much. Kindly take your seat. So typical of Fast Ghana and then the NCD Alliance Ghana, we are always mindful, of who is in our meeting. We have no objection inviting clear minds, but when your objective does not, align with our principles, then it becomes something difficult. So we want to know your name. I don't know why you're laughing, my man, from the Spider Network. Yeah, so we want to know your name and where you are coming from. If you can start from Mr. FCU.
Hi, I'm Abdul Fatah. I'm coming from the Federation of Community Organizations. Thank you.
Good morning. My name is Christopher Aguga with the Ghana NCD Alliance as a peer trainer and an advocate. Thank you.
My name is Derek Kwame Buchi. I'm a journalist, Ghana News Online and the Spider newspaper.
My name is George Wilson Kinsey. I'm the chairman for Media Alliance in Tobacco Control and Health.
Good morning. My name is Kafui Danso, Minister of Health Policy Unit.
Good morning. I'm Didi Sagudo, Narcotics Control Commission. Thank you.
Good morning. My name is Aisha Tizibiru from Community Health Support Team.
Good morning. My name is Martha Kofi with the Ghana NCD Alliance Mental Health Disability Right Advocate.
I'm Poma Isaac, Concern Health Coalition.
Good morning. My name is Ebenezer Adams, Executive Director, Stroke Association Support Network Ghana, cum Vice Chair, Ghana NCD Alliance.
My name is Abet Aluti, Ghana News Agency.
My name is Ayi Akudede Eugenia. I'm a National Service Personnel with Fast Ghana.
Okay, I'm Intiri Benjamin. I'm with the Ghana Education Service School Health Education Program.
Benefo Isaac from Jaishi, Ghana.
Hello, everyone. My name is Kelvin Mauli Kofibuam. I'm with Youth Advocate Ghana.
Hello, my name is Baba Sam. I'm with Zen Ghana. Good morning, everyone. My name is Ni Odwe Odote. I'm with the National Development Planning Commission.
Good morning, everyone. My name is Emmanuel Abuchi. I'm also with the National Development Planning Commission.
All right. Thank you very much. I'm happy about the array of participants in the room, from the Narcotics Control, Ministry of Health, the media, the youth group especially. I have Jaishi, and then I have youth, whatever, youth something Ghana, youth advocate Ghana. Yeah. I've forgotten the lady who used to attend our event. Vivian. All right. So nice to see you. All right. So we are here for a good reason, basically. And the video we watch gives us a background of why we are here. The work we do as Fast Ghana is usually, facilitated by evidence-based, advocacy or research. And we've been able to do this work over the years. I have been part of the process to ensure that things which are not so clear in the public domain, we are able to find ways to ensure we bring them to bear so that people can be aware about what goes on behind the scene that usually most people don't think about. That's why we are here. There are some, we are fighting a very big industry. From the video we watch, they have the money and they have good lawyers. The man, if you watch the video, says, yes, tobacco causes cancer, but we are not sure whether this particular cancer that kills the man is as a result of tobacco smoke. And it's a good point. They can argue about that unless you have evidence that goes beyond what everybody knows. And so that is the reason why we are here. And before we zoom into the main presentation, we want to have the welcome. And I'm so much excited and happy to introduce my boss. My boss, that's Labran Musa, who is going to give us the welcome. But before then, let me share a bit of a background, just 3 or 4 things that has happened recently. It's always important to commend. If you're a good student of the Bible says, a man who does so well in whatever he's called to do, he will stand before kings and not obscure men. And so he is currently the executive director of Fast Ghana, also the national coordinator of the NCD Alliance, the secretary to the African Network on NCD, and recently was awarded among 69 extraordinary health advocates. He happens to be one of the champions on UNC. That's 2025 World No Tobacco Day Award winner. He also the 2025 UNC champion, elite global cohort of 69 extraordinary health advocates. And I'm happy to add that just last week he observed or celebrated his 16th marriage anniversary with one woman, even though he's a Muslim. I want us to invite my boss, Lavron Masaudu Musa, to give us a welcome address. Thank you. You're supposed to give your
Well, of course, no comment for now. Right. So thanks so much for those kind words. Yes. Please, can those online hear me? Please. Somebody, you introduce this online. Do you have online participants? Okay, great. So I'd wish we acknowledge those online, but I think probably after my presentation, if you can do that. So we know those who are also online and are with us. Very important.
All right, so you can still be here. Can we have a short introduction for our colleagues via online, with the exception of the presenters, which I will do later? Kindly unmute and introduce yourself. If you can give me their names so that. Brenda. Hello, Brenda. Can you introduce yourself? That's if you can hear us. So who is after Brenda? Who? Sarah. Hello, Sarah. Can you hear us?
Yes, I can. Good morning. My name is Sarah Kwale.
From where?
I'm currently from Itaba. I'm joining in from Nigeria.
All
So
right.
glad
Thank you
to
so
be
much.
here.
Thank you so much, Sarah. Who else do we have online? The names are strong here. You mentioned it anyhow. Mohili. Mohi. Hello, Mohi. All right. So as and when we get to introduce them, thank you very much. Emmanuel. Hello, Emmanuel.
This is Brenda Chief joining from Zambia.
Okay, Brenda from Zambia. Thank you so much for joining. You're welcome. Emmanuel. All right. So as and when we keep introducing them, thank you. Is there any other person? All right. Thank you so much.
Right. So thank you very much. And I want to believe you know why we do this, just so we know who is with us. I mean, who is joining us, who is listening to us, because we are very mindful of industry interference and what they can do to subvert even meetings or to distract our meetings. So we try as much as we can to know that at least we are covered and we are being safeguarded. Right. So on that note, let me begin my welcome. I mean, by saying that a representative of the Ministry of Health present here, the Ghana Health Service, they are not here, but I hope they'll join us soon. The Ghana Revenue Authority, Narcotics Control Authority, Commission. I hope they become authority soon. Same with the National Development Planning Commission. Hopefully, we will become authority soon. Food and Gas Authority, and then the media present here. We also have colleagues from civil society fraternity. I think as we move along, we would introduce them. Ladies and gentlemen, distinguished guests, members who have joined us online, particularly our esteemed presenters who will be speaking along the side of the project or the program. Ladies and gentlemen, distinguished guests, esteemed partners, media, and fellow advocates for public health. Good morning and welcome to this strategic stakeholder engagement meeting organized by the Vision for Facilitated Sustainable Development, FAST Ghana for short, to officially launch and disseminate the findings of the Ghana 2025 Tobacco Industry Interference Index. It's an honor to stand before you today at this important occasion as we welcome all of you together to confront one of the most pertinent or one of the most persistent threats to our public health and a nation's health and also the future generation of our country. First and foremost, allow me to extend my heartfelt acknowledgement and appreciation to some key dedicated contributors to this important report or index that we are launching today. I wish to specifically acknowledge or recognize Mr. Godfred Tunibu Akodia, who is in our midst today. Can we see you by hand? The Research and Policy Manager of FAST Ghana, who tirelessly and efforts and commitment, led to the development and finalization of this report. Indeed, he played a crucial role in the development of the report. Also, Mr. Geoffrey Okansi, who is not in yet, but he's the Executive Director of the Revenue Mobilization Africa, who's here to join us, and also Mr. Ni Amankwa Adu, the ED of Green Tax Youth Africa, who is also here to help join us today. In fact, they help us in gathering evidence that enable us to come out with this report. A special word of thanks goes to Professor Atisink of the School of Public Health, University of School of Public Health, KNUST, that's the Kwame Nkrumah University of Ghana, University of Science and Technology, who will also be joining us online for her comprehensive and expert review of the report. In fact, she gave us an independent, review of the report, which has enriched its quality and credibility. We're also deeply grateful for the technical guidance and oversight provided by Dr. Mary Asunta and Mr. Yothim and De La Rosa, who are all online, who will be making presentations shortly after I have spoken, of the Global Center for Good Governance for Tobacco Control, that GGTC. Their global expertise has been instrumental in ensuring the index reflects rigorous standards and meaningful insights for Ghana. Finally, I must commend the steadfast support from and within the vast team, the staff, particularly Mr. Nofuli and Winston Gamo, for their assistance throughout the commitment they put in coordinating the overall project or overall initiative. We are also mindful to recognize the Africa Tobacco Control Alliance for coordinating the African Region Index report. Indeed, we'll be hearing from them what the Africa report looks like, and as far as the index is concerned with respect to the tobacco industry. Now, your collective dedication inspires us all and underscore the power of partnership in safeguarding public health. Tobacco remains one of the most deadliest epidemic that knows no borders. Globally and in Ghana, tobacco claims millions of lives every year. Each year through cancer, heart diseases, respiratory diseases, and many other non-communicable and preventable diseases or conditions. In Ghana, tobacco use leads to the death of 6,700 premature deaths annually. It burdens our healthcare system with avoidable costs and also preventable costs, and it also perpetuates a cycle of poverty through lost productivity and family hardship. In fact, it leads to abject poverty. That's what research is telling us. Particularly alarming is the tobacco industry ruthless and calculated tactics that is targeted on our children, young people, and the youth, and more especially the poor and the vulnerable in our communities and in the population at large. The tobacco industry deploys predatory strategies such as placing advertisement and positioning products at children's eye level. If you do marketing, you know what I'm talking about. They are very strategic in ensuring that they hook our children into using the tobacco products. To the extent that they do this in near schools and playgrounds. What has tobacco got to do with schools and then also playground? But this is what we see in Ghana and many other African countries. So what they do that they introduce flavored tobacco products. It's small and affordable packs. A pack of 10 cigarettes, which you cost so less. And then also the tobacco industry through its retailers offer cigarettes in single sticks, including candy-like fruits or menthol varieties. This strategy disguises tobacco as harmless and appeal directly to young people and children. These are not incidents. They are deliberate effort to hook our next generation into the use of tobacco and also lifelong addiction, ensuring profits at the expense of health and the future of Ghanaians. In Africa, including contexts close to ours, which is Ghana, companies have been documented using these ploys to exploit weaker generations or weaker regulations and create new smokers and tobacco use among our children, especially those in school and also adolescents. And I'm sure you have heard of the new emerging tobacco product like the shishas and also the new emerging product like e-cigarettes, which our children are now obsessed with because of the industry, activities, including marketing. It's important to highlight that not much progress is made with respect to tobacco or respect to the implementation of the FCTC in Ghana, especially with respect to the Article 5.3, which we are here to talk about today. A recent civil society report led by the Vision for Accelerated Sustainable Development, VAS Ghana, on the implementation of the WHO FCTC and Empower has revealed a slow pace in the overall implementation of the FCTC. A primary concern raised in the report is the lack of transparency regarding interaction between public health officials and tobacco industry. Although Ghana is a signatory to the WHO Framework Convention on Tobacco Control, the report claims that meetings with industry often occur without public notice or disclosure. It's a key component of the WHO framework, which Ghana is a signatory to. So we call on, government to do the needful by ensuring that meetings of this nature are disclosed to the public, especially for civil society and the media, to adequately, participate in this meeting. It also highlights that there is no publicly accessible government, repository, detailing the activities or lobbying efforts of the tobacco industry, which is one of the key fundamentals of the FCTC. A shadow report, which was reviewed, also recommends a code of conduct to guide public officials' conduct and limit their interaction with the industry, which is very, very significant. And we are aware that the FDA is currently working in developing one. Ladies and gentlemen, we cannot stand idle while the industry profits, from addiction, from addicting our children and undermining our development goals like the SDGs, and then also eroding the gains we have made with respect to tobacco control and public health. You and I know that the prevalence of tobacco in Ghana is below 5%, which means that Ghana is nearing the end game of tobacco use. But of course, the industry will not sit idle. That's why they are now using our kids, get them hooked to new and emerging tobacco products so that prevalence will grow high. But we will not allow that to happen. Finally, I wish to sincerely thank the Global Center for Good Governance, GGTC, in tobacco control, especially Dr. Mary Assunta for the support. Throughout the process, we celebrate this wonderful and amazing personality. In fact, she's an amazing woman within the tobacco control fraternity across the globe, and leading this effort, the global effort to expose the tobacco industry. Most especially, we also want to thank Bloomberg Philanthropies for providing the financial support that has aided us to come this far with respect to ensuring that industry is regulated as much as we can. Finally, we thank all of you once again for your presence, passion, and partnership. On this note, I wish to duly welcome all of you. May the good Lord bless our homeland Ghana and our efforts. Thank you very much for your attention.
The clappings are wiggle. Yeah. Thank you very much, Mr. Labrang Musa, for welcoming us to this strategic meeting. So basically, what alarms me the most has to do with the fact that this is an industry that targets especially our children, who are very vulnerable and ignorant about the dangers of the product. And beyond even targeting our children, they are engaging those who are supposed to, initiate laws or policies to protect us behind the scene without our knowledge. And sometimes getting some of this information is a very difficult thing. If you don't have good people, who cannot be bought, then it means our development will be, stuck. And that is the challenge we are having as a nation and as a people. So it will take advocates, who are more in touch with the grassroots. We are doing a lot of education, but we need to do more. Most of the advocates we know who are working on the ground, if you speak to Jaishi, for instance, he will tell you they are ready to work, but availability of funds limit them sometimes to go to do much. So we are here. Let's see how we can discuss and grow from this session. All right. So, like my boss said during his welcome, he made mention about some few people, and it's always important that when you have such experts in your midst who would unpack the issues and make it real and understanding to our level. Once you understand what the issues are, making a move becomes very easy. And so this morning, to help us have our first presentation, will be Dr. Mary Assunta, who is the head of the Global Research and Advocacy at the Global Center for Good Governance in Tobacco Control, and a partner in STOP, and principal author of the Global Tobacco Industry Interference Index. She is a Luther Terry Award recipient in 2003 for outstanding leadership in tobacco control, representing low and middle income countries in many platforms to counter and debunk tobacco industry tactics. She has more than 20 years of experience in international tobacco control advocacy. Mary is the principal author of the Global Tobacco Industry Interference Index. She has a doctorate in public health from the University of Sydney School of Public Health, where she serves as an adjunct senior lecturer. This morning we are blessed to have this big person in our midst to share with us. Grandma, thank you so much. This is the first time we are meeting in this year. Happy New Year. You have the stage now. Let's have your presentation. Thank you very much.
Thank you so much, Simon. And also thank you, Labram, Musa, and team for this good opening speech and also kind words of acknowledgement. Hello, distinguished participants. On behalf of the Global Center for Good Governance in Tobacco Control, GGTC, I want to thank VAST for this opportunity to present the launch of Ghana's Tobacco Industry Interference Index. This index is an important document as it provides a window into what is happening in Ghana in terms of protecting public health from the tobacco industry. I will be providing a few key findings from the Global Tobacco Industry Interference Index, which covers 100 countries in 2025. And I want to thank all the contributors from the 100 countries who did their country reports, including Ghana and the BASC team, which then we collated and made the Global Tobacco Industry Interference Index. So with that, I'm going to share screen and also present the slides. I would like to begin by pointing to a very important article called Article 5.3 in the WHO Framework Convention on Tobacco Control. It is this article that we will be looking into in greater detail. This is a very important article which forms the backbone of the FCTC, because this article says that parties shall protect their policies from commercial and other vested interests of the tobacco industry in accordance with national law when they are implementing and developing their public health policies. So that guidelines to this article was then developed by the parties and adopted in 2008. So what has happened since 2008 to the implementation of this particular article? So the Global Tobacco Industry Interference Index is a civil society review of the compliance of the countries to this important guidelines. As I mentioned, 100 countries participated in the Global Tobacco Industry Interference Index, and the way this index works is that the countries prepare their country report. They have to answer 20 questions, which is based on the Article 5.3 guidelines, and we assign scores. So the higher the scores, that means that there's a very high interference level from the tobacco industry. So lower the score, the better it is, and it is indicated by colors. We've assigned colors. So the lighter colors, yellow and light green, which means less interference, and brown and dark red, maroon, those colors indicate a higher level of interference. So basically from this global map, you can see that no country is spared from tobacco industry interference. In fact, what we found in the 2025 index is that the tobacco industry has become more aggressive. It has exploited policy loopholes. It has dissuaded, enticed, and it has frustrated governments right across the globe in their efforts to protect public health. In other words, the industry tried to thwart government efforts. So I speak directly to the representatives of the government present in the meeting today, and I would like to say that you may have experienced some of the interference in Ghana. As you can see, Ghana is, the color is blue, which means that it's not in the low level, but neither is it in the high level. If you look at what is Ghana's, or if you ask me what is Ghana's ranking, globally out of the 100 countries, Ghana is ranked 38, which is the blue color, and out of 20 countries in Africa, it is positioned 11th, which is somewhere in the middle. So it is not doing very well, but neither is Ghana, at the bottom. So it's somewhere in the middle with a fair level of interference. What this means is there is room for improvement, and Ghana is actually on track because it has done well in some areas, and we will hear more about that later. But we need to find out how is Ghana responding to tobacco industry interference, and how are you implementing the laws which specifically address industry interference. So I'd like to bring you a few major or key findings globally, just to give you an idea of what's happening around the globe, so that you'll be able to position how Ghana is, and then to consider what are the next steps. So there are seven categories that we looked at our indicators, and one of the indicators is how can you address industry participation in policy development. Actually, government officials need to ensure that the tobacco industry is not allowed to participate in policy development. So we found that 18 countries around the world strengthened their protection measures of their policy by adopting or enforcing Article 5.3. But that's 18 out of 100, which means that there is still a long way to go. And we found that more than 60 countries were influenced by the tobacco industry in various ways. They either failed to raise tobacco taxes, or they delayed increase in taxes, or they, in some cases, they even lowered tax increases, particularly for new tobacco products such as heated tobacco products or e-cigarettes, or they granted exemptions to the industry in terms of some incentives that were provided. One area that really stood out is that of e-cigarettes and heated tobacco products, and we found that the tobacco industry pressured many countries to embrace or to allow e-cigarettes, nicotine devices, nicotine pouches, flavored e-cigarettes. And the way the industry interfered was, in fact, there were several tactics. One is it tried to revoke bans that are already in place, or it took governments to court. For example, Panama, they have a ban on e-cigarette, but they were challenged in court, saying that the ban violated the constitutional right of Panama, and they won. In other places, they weakened the regulations, and this really happened in the Philippines, or they opposed or delayed tax increases of these products, or they lobbied policymakers to pass laws that are favorable to the industry. But how did governments push back on how industry interference in regulating or in banning e-cigarettes? We know that at least 46 countries around the world have banned e-cigarettes, heated tobacco products, including several countries in Africa, as you can see. And for Ghana, we know that Ghana banned in 2023 all recreational use of vaping and e-cigarette products. But we also found that e-cigarettes are registered as a prescription-only medicine for purposes of cessation. I'm not aware of the current status, but we know that Ghana is in the taking the right approach towards this, which means that the pressure will be on Ghana to try to allow e-cigarettes in the market. But all the evidence that is coming in now shows that actually these products are harmful, and none of the countries have actually really registered them as cessation products. And in fact, countries that allowed e-cigarettes are now find themselves with a double addiction. That is, they haven't quite addressed cigarette addiction, and now there are all these new products that are just being added to the list. Denormalizing tobacco-related CSR, or corporate social responsibility activities, is another important point in the guidelines of Article 5.3. And we know that 32 countries, including Ghana, have actually banned tobacco-related CSR activities. And there are many other countries that have actually strictly, very, very strictly regulated them, like don't allow publicity of these activities. We also know from the reports that the countries submitted that the industry has targeted the non-health agencies with its charity and its activities. It has latched on to government priorities, particularly during the COVID pandemic, and then it appealed to willing ministers and parliamentarians by enticing them with CSR activities. We know that CSR activity is a form of promotion. That's the way the FCTC defines it. And so when a government accepts charity from the industry, then it compromises its role as a regulator of the industry. So the best way forward would be to ban these activities as the way Ghana has done. It's also important to identify what are unnecessary interactions with the tobacco industry, and this again is one of the requirements in Article 5.3 guidelines, that there must be that governments should only interact with the tobacco industry when strictly necessary to effectively regulate the industry and the tobacco products. That's the only time you interact with the industry. Unnecessary interactions, therefore, will occur when high-level government officials meet with the industry to foster good relations or to make agreements or to collaborate with it. And that's where the problem then begins. So to give you some examples that we found around the world, members of parliament or ministers or governors, they accepted sponsored study visits to the tobacco company facilities. These facilities particularly in Switzerland and in Italy. And we found that at least 19 governments collaborated with the tobacco industry, and the way the collaboration is done is through memorandum of understanding or through providing training sessions. This is the tobacco industry providing technical assistance or training sessions to government officials on how to tackle smuggling. And this is really a classic example of how an unnecessary interaction can take place. Transparency is a requirement. Transparency in interaction with the tobacco industry reduces interference. We found that there are 14 countries that have got lobbying laws. That is, they also have a general register for lobbyists, which is accessible to the public. So countries listed here like Belgium, Canada, Finland, France, Germany, Italy, so on, they have got lobbying laws, and the law will require a register. So this is not just specifically for the tobacco industry, it is across all corporations, so that governments and legislators and policymakers know exactly who these lobbyists are, and how to deal with them, because lobbyists represent corporations. But the tobacco industry often, does not identify who its representatives are, and governments can be misled into thinking that they are experts, because they are often referred to as experts or independent consultant, but they are in essence lobbyists. None of the countries in Africa have a lobbyist register, and I think it's about time that this is actually done. Article 5.3 guidelines also calls on governments to avoid situations of conflict of interest. What does this mean, a conflict of interest? A classic example is when a high-level government official, for example, someone from, the Director General of Customs or the Attorney General of the country, or, the Director General from the Department of Finance or Inland Revenue. When they retire, you find that the tobacco industry will headhunt them or poach them to become consultants for them, or to actually join them in their boards. Such examples have been recorded around the world. But good practice on how to avoid the situations of conflict of interest would be to have an exit policy in employment. So Kenya, for example, when high-level government officials retire, they have to wait 3 years after leaving public service before they can choose to go and join a corporation, or the tobacco industry. And in Uganda, the officials must wait 2 years. The reason an exit policy is good because when you if government officials go directly from government to the industry, then then they will be representing the industry and knocking on the doors of of the government that they had just only recently served, and you find that they will actually command respect of who they were previously, and it's very difficult for regulators and legislators then to feel free to do tobacco control. So there are many countries that actually have got good practice in Article 5.3 already in place, and there are two ways in which a country can do it. A country can either incorporate elements of Article 5.3, that examples that I've given, through the legislation, that is tobacco control legislation. You can do that, or secondly, you can do it through circulars, directives, or code. So the best way would be through legislation, and we know that at least 3 countries in Africa, that's Botswana, Uganda, and Kenya, have actually incorporated elements of Article 5.3 into their legislation, and Ethiopia as well through a proclamation. And this is ideal because then when it becomes law, then there will be compliance and there will be penalties for breaking the law. On the other hand, there are a bunch of countries that have actually decided to have circulars or a directive or a code. It still is applicable to the whole of government, but it's an easier path to take because you don't have to go to parliament in order to pass the law. So this is an easier path, but however, you find that if you choose to follow this direction, then there will be no penalties because this means that you've got to be really very strict in implementing it. Otherwise, the industry will try to break them, and you'll find yourself in a situation which is hard to actually respond because if you haven't factored in penalties for breaking the circular or the directive. So some of these countries listed here, Australia, Brunei, Canada, Costa Rica, Philippines, they all have got really good circulars and codes. The Philippines was the first country to come up with this code in 2010, and it's pretty comprehensive. And other countries have actually borrowed from it. Australia has got a really good code as well, and I want to stress that these codes apply across the board to whole of government. In other words, even the non-health agencies such as finance, customs, agriculture department, departments, they are all public officials abide by the code. I want to give you 2 examples from Africa. Uganda has got a really good law. When they developed the Tobacco Control Act 2015, they incorporated elements of, in fact, practically the entire section of Part 8 is actually from Article 5.3 guidelines that has been incorporated into their law. So, there is the Uganda National Tobacco Control Committee has just on the 15th of March, just a few days ago, have actually signed a no conflict of interest declaration aimed at safeguarding public health policies from interference of the tobacco industry. This is really good. And here's a photograph of that meeting that took place on the 15th of March. So Uganda has got good law and is now moving in the right direction to ensure the implementation of their good laws. For Kenya, their Tobacco Control Act 2014 in Part 5 has got elements of Article 5.3, which is also really good. And transparency and interaction with the tobacco industry is the element that is highlighted. And what that portion of their law says is that any interaction between public health authorities and public officials of the industry shall be limited to the extent strictly necessary for effective tobacco control and enforcement of the law. So this is exactly what Article 5.3 says, and they have actually incorporated that into their law. And then there is the element of disclosure as well, that a public officer who has any interest in the tobacco industry should actually disclose the nature of that interest on commencement of employment. This is any public official. And they also need to declare and then to divest their interest in tobacco control. So I think for Ghana, and just like for Kenya, they need to adopt a code of conduct that applies to all public officials. So in conclusion, governments must implement Article 5.3 as a whole of government approach. The whole government has to act cohesively. Often, what happens is only the Ministry of Health is left to implement Article 5.3, and sometimes they will face challenges when they do that because then the ministry has lobbied the other departments. So that's why it's important for the government to act as a whole. And governments need to either adopt a legislation or a directive or a code on 5.3 that applies to all public officials. They need to stop giving incentives to the tobacco industry, which I've highlighted comes in many different forms. And the government needs to require greater transparency of interaction with the tobacco industry for increased accountability. GGTC has got lots of information available on our website, so I hope you will have time to visit it. There's also a fact sheet, a country-specific fact sheet that we've prepared for Ghana. In fact, for all the countries that are participating, there's 100 countries in the Global Tobacco Industry Interference Index. With that, thank you very much, and I welcome your questions. Thank you. Over to you.
Thank you very much, Mary Azuta. Thank you so much. I would want to urge you to still hold on. Probably there may be some few questions as a way of follow-up. That is after Caleb's presentation. So if you can hold on and follow the session a bit for us. Thank you so much. All right, so having over 100 countries, participating in this index globally tells you that we are fighting a very big industry, very important. And then she also spoke about the industry participation in policy development. Recently, I was in one meeting where the convener said, for him, he's ready to go and meet the industry and talk to them. He's sure they'll listen. I watch him and I laugh. There's an industry that has a focus of making profit. And you take with your advocacy, you want to go and meet them and confuse them. It's one area most people don't really have so much in-depth, industry interference. 46 countries have banned e-cigarettes. It looks good. If others have done it, it means we can also do it. That is the message here. And then denormalizing industry CSR. I was also in a similar meeting and I asked a question that you find yourself in a very difficult situation. And the support came from an industry, whose product is as a result of what your child or your partner is going through. Will you take it or you reject it? It's a very difficult question. Yeah, because you are going to caught between a dilemma where either to take the money or not to take it. If you take it, probably it may save your child's life. If you don't take it, the likelihood that your child will die is also high. And then to hear that no country in Africa have a lobbying register. So Labram, I don't know what, probably in our subsequent projects, we'll see how we can push this. But it's something for advocates here that we can take it along, that we need to have a lobbying register. 40 countries have a lobbying register globally. And then what strikes me the most is countries with good practices on Article 5.3, and Ghana is nowhere, even though we believe we are doing so much. Thank you once again so much, Mary. We'll get to you when we have some few questions. So to introduce our next speaker from the African Tobacco Control Alliance, Caleb Ayong is a communication specialist and seasoned tobacco control expert with over a decade of experience supporting public health initiatives at both the national level in Cameroon and continentally across Africa. Currently serving as a consultant for the African Tobacco Control Alliance, that's ATCA. He plays a pivotal role in advancing evidence-based policies and advocacy strategies throughout the region. His extensive technical background is backed by specialized certifications from prestigious institutions, including the University of Pretoria, Sefako, Makatu, Health Science University, and the Harvard T.H. Chan School of Public Health, underscoring his commitment to fostering a tobacco-free Africa. Caleb Ayong, if you can hear me, this is your moment to share your presentation in the next 10 minutes. Thank you very much. Caleb.
Thank you very much.
Thank, thank you.
I hope you can hear me.
Yes, please, we can hear you.
Thank you. Thank you very much. Thank you for this initiative. And thank you to Vast Ghana for inviting ATSCA to the launch of the Ghana Tobacco Industry Interference Index. A big thank you as well to Dr. Asunta, who has already given a very clear explanation as to what the index is all about. In fact, she makes my work very easy because I would really just be complementing the information she has provided with some information from Ghana or around Africa, focusing on the continent. So, like has been introduced, I represent the African Tobacco Control Alliance. This is a network of civil society organizations in 39 African countries, and we have the mandate to coordinate our members' civil society initiatives in across the continent. And we are privileged to have been part of the partners who supported the development and actually published the Regional Tobacco Industry Interference Index, which comes from the country reports of the African countries involved in the Global Tobacco Industry Interference Index. So today I'll be looking at, I'll just be giving an African perspective to the Tobacco Industry Interference Index 2025, and I'll dive into it very quickly. Just to state that a little bit about the index, Dr. Asunta talked about 100 countries globally. Out of these 120 are from Africa. So we can see that the index, Africa has at least one-fifth of the total number of countries. I think that is impressive for the continent and impressive for our efforts to ensure good governance amongst our public health systems in the continent. The objective of the index is, like Dr. Asunta said, to assess how well the level of tobacco industry interference in these countries and how well governments protected or shielded their policies from this interference, from the tobacco industry interference, as required by Article 5.3 of the WHO FCTC. And Dr. Mary already mentioned there were several indicators used to measure these interference from the tobacco industry, and we have the indicators here: participation of the industry in policy development, corporate social responsibility initiatives, benefits accorded the tobacco industry, and when there are unnecessary interactions with the tobacco industry, or when there is no transparency, when there are conflicts of interest, and when the preventive measures taken to ensure that we keep our policies safe. And on the right, you can see the 20 countries from Africa that are involved in the index. So let's talk about some key findings from the index in Africa. A lot of these things were already mentioned by Dr. Asunta, but here we'll just go into some of the specifics in the various countries. One of the findings of the index on the first indicator was the tobacco industry's interference in policy development, and there were some countries that recorded some very high level of interference, countries like Congo, Malawi, Nigeria, Tanzania, and Zambia. And then there was also tobacco industry involvement in corporate social responsibility, and we've already heard why this is problematic, because it gives the tobacco industry a face that it doesn't deserve. It makes them seem like a partner in the development of our economy, which is really not the case. And in this sphere, we had Gabon, Madagascar, Nigeria, Tanzania, and Zambia reporting very high levels of involvement in corporate social responsibility by the tobacco industry. Several countries, countries like Kenya, Zambia, Tanzania, and Nigeria, accorded benefits to the tobacco industry. And of course, these are some of the consequences of the CSR we just talked about. Some of these benefits range from tax exemptions to duty-free allowances, and sometimes the industry is accorded abuse and interfere in the evolution of these policies. And Dr. Asunta talked about unnecessary interactions with governments, between governments and the tobacco industry. In Malawi, Madagascar, Zambia, Gabon, and South Africa, we saw there were reports of such interactions not necessary, that are not necessary. And of course, some of these underscores the lack of transparency because some of these meetings occur with no disclosure. In Cameroon, in Cote d'Ivoire, in Madagascar, in the Democratic Republic of Congo, in Mauritius, in Mozambique, Senegal, and Zambia, there were cases of, or there were reports of certain countries holding meetings, or government officials holding meetings with the tobacco industry without disclosure, with no disclosure. And then, of course, Dr. Asunta also talked about conflict of interest, where government officials immediately go on site. Please, there's some call. Pepechi, can you mute yourself, please? Pepechi, can you mute please? We are getting you. Thank you. So, thank you so much about that. The conflict of interest. I was talking about cases of conflict of interest where government officials are easily integrated. Senior government officials leave office and then directly get engaged in with the tobacco industry or vice versa. That was found in the DRC, in Malawi, in Ghana, and in Tanzania. And of course, preventive measures. There were several countries who had no preventive measures to protect the tobacco industry, to protect from tobacco industry interference. And in many of these countries, also, there was no procedure in place for disclosing such interactions. There were, however, some positive trends recorded in the index. In Cote d'Ivoire, for example, the tobacco industry is not part of their technical monitoring committee. In Burkina Faso, they have taken measures to avoid all forms of tobacco industry interference. One good thing is that in all 20 countries, there was no report of tobacco industry representatives in the previous, not the last MOP, because the last MOP, Conference of the Parties, COP and MOP, took place in Geneva just in November last year. But this report focuses on events prior to that. So, according to the count, the 20 countries, there was no representative of the tobacco industry in their MOP and COP delegations, and that was MOP 10 that took place in Panama in 2024. And then there was also some positive trends recorded in terms of avoiding corporate social responsibility, because we had Burkina Faso, Cote d'Ivoire, and Chad reporting no support from the tobacco industry. And with regards to unnecessary interactions, countries like Kenya, Mauritius, and the DRC had minimal or no interactions at all, while there were strict restrictions on interactions for Senegal, Botswana, and Ethiopia. And with regards to transparency, Botswana reported that it is legally required, or there needs to be some legal requirements for public disclosure if ever there's going to be any interaction between the tobacco industry and government officials. In Burkina Faso, it must be undertaken in a strictly transparent manner, and in Ethiopia, it is strictly controlled. In terms of conflict of interest, there was no conflict of interest recorded in Uganda and Ethiopia, and in Botswana, Nigeria, Ethiopia, Uganda, the law strictly prohibits countries from contributions. The law prohibits contributions to political parties or to support election candidates. So the tobacco industry cannot fund political elections or political campaigns in these countries. And then one very good piece of good practice was found in in Chad, in Ethiopia, in Nigeria, and Uganda, they all have a code of conduct for interactions between government officials and the tobacco industry. The reason we are having this discussion today is because we want to effectively um, uh, 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 prevent government, or rather, we want to effectively protect our public health policies from tobacco industry interference. And I put up this slide just to enable us, just to share some insights on how we can a country can effectively shield its policies from tobacco industry interference. First of all, we should be thinking of having a multi-sectoral tobacco industry monitoring and response team. Multi-sectoral because the tobacco industry can infiltrate any sector, and the wider the scope of our team, the more effective we are in spotting interference attempts by the tobacco industry. Of course, we need to involve the media because they play an important role in informing and shaping ideas and policies. Of course, we need to build capacity of both civil society and government, and we need to advocate for policy adoption. We need to monitor the implementation of the policies we have adopted, and above all, the overall objective, of course, is to do everything we can to protect our policies from tobacco industry interests. So whether we are trying to adopt a policy or implement it, or to build capacity, or to involve the media, or to create a team, a multi-sectoral team to monitor the industry, the general objective is to ensure that we can always protect our policies from tobacco industry interest. And I would quickly talk about a regional strategy that ATCA is undertaking to counter the tobacco industry. First of all, we call it 15 tobacco industry monitoring and response teams. We've set up teams in 15 countries, and we have 20 countries involved in the 2025 Tobacco Industry Interference Index. We see that thanks to ATCA and other partners, there are now appropriate tools that we can use to monitor the tobacco industry. And with all of this, we see an increased willingness of regional bodies to engage in tobacco control. The effective or the results of all of this is a more conducive environment for a regional tobacco control strategy. And at the level of ATCA, we do undertake initiatives to support Article 5.3 or strong tobacco control legislations, and we also support national tobacco control focal points whenever we are called upon to do so. We do our best to strengthen enforcement mechanisms, and we advocate, we support multi-sector partnerships, we support capacity building initiatives, we support information, knowledge, and experience sharing, and we support initiatives to counter the tobacco industry's narratives and strategies. Confronting the tobacco industry needs to be holistic, and it needs to be multi-sectoral, and ATCA is proposing, of course, that we counter several of such strategies, including the tobacco industry's use of emerging products, the tobacco industry's promotion of illicit trade, as well as arguments by the tobacco industry that tobacco farming is substantive and economically strong for economies or for countries. Of course, we need to counter that with the possibilities of alternative livelihoods and exposing how tobacco farming actually destroys economies, hinders on the health of farmers, and of course all the other negative environmental depletion and all of that. Those are important aspects that we need to look into as we always try to get regional strategies to counter tobacco industry interference. And I'll conclude this session by once again thanking Avast Ghana and congratulating the country as a whole for its tobacco control strives. But of course, we still have a lot to do. Dr. Asimta talked about supporting a code of conduct for engaging with the tobacco industry and lots of other initiatives that I know Ghana is currently undertaking in tobacco control. Strategies like increasing taxes to support, to raise revenue and support public health, and many other initiatives that are happening in the country. It is a collective fight we need to do together, and initiatives like the Tobacco Industry Interference Index show us just how we are performing and give us an opportunity to do better so that together we can sustain it, we can effectively and sustainably protect the health of our countries. That said, I want to thank you very much for your attention, and of course, we are open to your questions. We invite you to also follow our work on our various platforms as highlighted in this slide. Thank you very
All
much.
right. So thank you very much, Mr. Caleb Ayon. Thank you so much. It's good to know that we have some countries in Africa who are doing very well. But then just a quick one for Mary Azunta and yourself, probably the same question from different perspective. I would want to know, since you are online, let me ask directly. Probably Mary will also share her views or thoughts on that. We've known that one of the barriers to the implementation of Article 5.3 has to do with industry interference. I want to know, as an advocate, beyond industry interference, what else, based on your experience and exposure working in this field for many years, beyond industry interference, what else are some of the barriers that hinders, the implementation of Article 5.3? Thank you.
Okay, thank you very much. I think I'll say a few words, and of course, Mary can complement. It is important to note that the first thing, the tobacco industry interference to me is the most prominent and the most important. And if we talk about other aspects, it is primarily because there is tobacco industry interference. But to answer your question, I think one of the things we can highlight is political will to protect or to ensure strict implementation of engagements aligned to or agreed upon by a country. The FCTC is binding for all signatories, and Ghana being a party to the convention has a responsibility to implement the provisions of the FCTC. But does Ghana have the political will, or do countries, do parties in general have the political will? Many of them might do, but sometimes because of influence or interference from the tobacco industry, um, uh, there might be hindrances, or there are always hindrances. And interference can come in several ways. It could be interfering in policies directly. It could be corruption. It could be some form of oil bribery is also another form of corruption. So in general, the tobacco industry is usually the principal cause of interaction. And should there be any other secondary reason, maybe why there continues to be interference, or there continues to be poor implementation of policies, it is usually because there is a tobacco industry which is there to push for these things not to happen.
All right, thank you. Okay, maybe Mary would have to share a bit of her views as well.
Yes, I want to add to what Caleb has said, and I want to say that the industry will only interfere if it is allowed to interfere. So it is the governments that actually allow the industry to interfere. So Article 5.3 has got to be implemented by the government. So the index that both Caleb and I talked about, the global index, the regional index for Africa, it is a report card on governments. It's not a report card on the industry, because the industry will interfere. but it is how governments are responding to that interference. And that's what this report is about. So it is only governments who can implement Article 5.3. It is in their hands. So and Article 5.3 is not a list of do's and don'ts. It should be seen as good governance. And Caleb referred to this, anti-corruption. Countries have got anti-corruption laws because it is good governance. So if you frame it as good governance, then you find that it benefits the government and the way the government functions. So that the government then carries out its mandate, which is to protect people and also to regulate harmful industries. And the final thing I want to say is with regards to a component of good governance is transparency and accountability. When there is transparency, Article 5.3 doesn't say don't talk to the industry. What it says is that when you only interact with the industry when it's necessary and it's for regulation purposes. And when you do that, when you're interacting, you need to do it in a transparent manner, which means there's got to be a procedure. So transparency is really important because it is a part of good governance, and also then it establishes accountability on the part of our governments. So it's not enough for the government to say that, oh, the industry is interfering. It actually has to then say, how have we allowed it to interfere? Thank you.
All right, thank you very much. We have one or two questions from participants. So if you could give it to Sir Adams, the Vice Chair of the NCD Alliance. From there, we have Martha and then Chris and Mr. Jeff as well.
So thank you very much. Hello? Hello? Yes. So thank you very much, Madam Azunta and Caleb. I have a question for you, Caleb. In your presentation, you did mention on multisectorial confrontation of the industry. I want you to throw more light on this. What you meant by the multisectorial confrontation of the industry. And the second question got to do with, actually is linked to what Madam Azunta presented on the indexing. Ghana being ranked 38, it doesn't mean that, of course, we are free. There's more to this. Looking at the numbers relating to NCDs, the current inflows, of course, incidents of NCDs that we are having, of course, in the country. So, Madam Azunta, I want to find out, we need to understand the dynamics between government, the industry, and other stakeholders. What other strategic approach can be used to reduce this ranking? Because we are not comfortable with 38. And if you rank 20 out of 11, Ghana ranked 11, this is not something that we should be we should be happy about. So what would be your advice? What approach should we use to reduce this ranking to the lowest minimum? Thank you.
All right, so let's have the other question. I'm sure Mary and Caleb are taking notes, so they would answer the questions. Let's have them.
Just from where Mr. Ads ended, I've been thinking loudly in the room, and I just want to find out at the regional level, what kind of efforts have been put in place in the strategy approach for the multi-stakeholder advocacy that Mr. Ads mentioned in Madam Azunta's presentation. If we have other stakeholders that are like the media and great influencers at the regional level that really can come up with initiative and programs that speak directly to the impact of tobacco usage within our Afro region. Does any of that exist? If it doesn't, then as a region, we should be looking at how to come together to form such a pragmatic approach and strategy using media, regional bigwigs media, and influencers. And also, are there availability where we can resource for funding in order for us to use evidential lived experience people who have been really impacted? Just like the tobacco what do we call it, the pull up that we have here. But then when we are using real individual experiences, reaching the hard to reach and people who have really been affected, it begins to bring out the light out of the impact of tobacco usage in the life of individuals who are suffering damages from tobacco usage. And we can use that as a pragmatic strategy to speak to issues, to get governments to act. Thank you.
Thank you very much, Martha. Let's have Chris and then Mr. Jeff.
Thank you so much. I wanted to ask before I ask my question, do we have anybody from the law enforcement agencies here?
No. The narcotics.
Okay, but in terms of law enforcement, I was looking strictly at those who are on the ground. I'm
Yeah,
looking
the
at
police. Yeah, they are not here.
and military, because if we are talking illicit trade, I think that it's important that they are part of the conversation, since they are the ones that are directly, at the helm of issues when that happens. Now, to my question, that Article 5.3 is great. I have an issue with the wording though, the strictly necessary. To me, it is open-ended. It's a bit vague. I know politics and I understand politics in Ghana. Strictly necessary can be a breakfast meeting. The politician will find a way of making it make sense. If you've been following politics in Ghana for a long time, so if there should be an amendment, and I'm hoping there is, could we be a bit more straight to the point on what we want it to look like? If we are saying no interaction, we are saying no interaction. If we are saying somewhat of an interaction, what does that look like? Because if some of the things provided in the article looks like we are hoping the politician or the government will do the right thing. So it is hoping that they are of good moral and that they will think about the people they are representing and then do the right thing. So there's no protection here. That is why even the lobbying law is actually very good, so that for stakeholders, when we have a report, we can look through and see what meeting went on, who were involved, who won the contract or whatever project, and then we can know how that went by. But if you say strictly necessary, a breakfast meeting could be strictly necessary. You understand? A government meeting with one of the tobacco agencies could be strictly necessary, because maybe there is an issue that needs to be discussed, and it needs to be discussed early. I'll come back with some other things to talk about, but if my question is, can we look at that wording and then change it to be a bit more direct?
All right, that's point noted. Thank you so much. Let's have the final one from Brother Jeff.
Yeah, thank you. For industry interference, I think we should not just look at the government direction alone. Academics are also at fault. There are the pro-industry academics who will actually research to support the argument of industry. Again, the CSOs ourselves, let us not run away from it. I think we should swallow some of the shame. There are some CSOs who actually advocate for industry. So let's not leave ourselves out. Let's call ourselves out. We are part of the problem. And then also, so there's some friendly provisions within the constitutional framework that allows industry to also make inroads. So, for example, if you saw that academics and CSOs may present papers to the parliamentary select committees and make impacts which would actually lead to the gain of industry. Again, another group is the lobbyists, and then also philanthropists and icons. Icons, in our nation's laws, there's a ban on them actually advertising. But if indeed you see them at gatherings and they are holding cigarettes, that's another form of promotion. And then lobbyists are going behind their doors and meeting with government officials, which you and I will not be there, but their actions are enormous. And then philanthropy, when people are donating to government, nobody asks where they got the money from. But these are persons who may be building some schools or maybe donating some hospital equipment, but it might come from their engagement with industry. and then the weak capacity. And now the biggest one that will make industry thrive better is when the citizens do not have the knowledge about the dangers of the industry and their operations, where they mistake the operations of industry to be an economic activity that creates job. But if you are actually active and enough to tell them that industry does X and Y and Z damage to society, I think they will begin to demand. Citizens will know that this is dangerous, and when there's a mass demand for a stop of the thing, I mean, no law, no constitutional provision is greater than the demand of the people for a halt of it. When the people of Ghana were seated and we heard that Parliament, a government institution which has a right to demand, decided to build a new parliament, that was not constitutionally wrong. But the people of Ghana, through our mass movement, in 3 days, in 72 hours, we were able to call for the shut to drop that chamber. So if the citizens are aware, their capacities are increased, they understand what we are talking about, they will demand a halt to the industry's function and performance. Thank you.
Thank you very much. That is a very good point. A very good point. All right. So, Caleb and Mary, if you are still with us, these were some few pointers or issues raised by participants, particularly online. All right. So, Caleb, Mary, either of you could take any of them that you want to respond to. Yeah.
Answering three questions really. The first one was what does Ghana do, and next steps for Ghana, and make some recommendations. But I just would like to elaborate on a couple of them. One is that the government must send a very strong message to the public that the government is serious about tobacco control and public health. And the government can do that. Actually, someone raised this point about public education. If the government is not conducting public education on the harms of tobacco, the public won't know that the government is serious. So implementation of whatever law that is in place, ensure that smoke-free public places are really smoke-free, and that the law is being implemented. And implementation, there's got to be public education about application of smoke-free laws and about the harms of smoking. So the government must send a very clear message to the citizens that it's serious about tobacco control. Number two, it's the government that has to denormalize the tobacco industry. So when you look at countries like Australia, when you look at Thailand, Singapore, it's very clear. The public knows that the industry has been denormalized, which means the industry cannot be pushing the boundaries at all. In these countries, you don't hear double talk. So often the double talk is there must be a balance between business and health. That's double talk. You can't have a balance between the tobacco industry and public health. The two are contradictory. So you have to choose. So the countries that have the double talk, you know that the laws will get implemented and the industry is not denormalized. This is where you find the conflict between ministries of health and ministries of finance and trade. So the government has to send not conflicting type of message, but it's got to be consistent in its messaging that it is for public health. So denormalizing the industry to the public is very important. The other measures, of course, adopting a code of conduct in Ghana should do pretty quickly. And this whole issue of e-cigarettes and heated tobacco products, online the message that I'm getting is that Ghana is unclear, that the status of e-cigarettes is unclear in Ghana. Well, that's what the industry is saying. So therefore, I think it's really important that the government sends a clear message as to what is its position on e-cigarettes. I want to also address the second question, which is on what does it mean to be strictly meet the industry only when it's strictly necessary. So basically, it is not just strictly necessary and then it's hanging in the air. Strictly necessary for regulation. So the guidelines are very clear. There are some basic steps, clear steps that is provided on what the government needs to do and how it can carry out meeting with the industry only when it's strictly necessary for regulation. So there's no ambiguity. It's for regulation. In other words, the government cannot attend a closed door meeting with the industry to make agreements or to go and shake hands and cut ribbons and hand out scholarships. Those are all unnecessary. Or to attend technical training or to go on study visits. So there are lots of examples. The best way actually for Ghana to move forward now is to look at this concept of what it means strictly necessary for regulation. Look at what other countries have done. There are several examples that you can look at. So Ghana is not starting with a blank sheet of paper where you don't know what strictly necessary for regulation means. Look at what other countries have done really well, and I will flag here to look at the codes of Philippines and Australia, which is very, very clear under what circumstances you meet with the industry and what does for strictly regulatory purposes only mean. The second related point is that you have to make public those meetings. In other words, when the Ministry of Health or the Customs Department or the Ministry of Finance meets with the industry, it's got to inform the public on its website that it's going to meet with the industry on the 25th of March and what the issue is about. And that is being transparent because you're informing everyone that you're going to meet with the industry. And for what purpose? For what purpose would then determine that it will be for regulation only. Okay? So once you make your objective very clear, I think it'll then set the tone on what is the industry, the government's position on the industry. And when the meeting is over, there's got to be some short outcome as to what had happened to that meeting, and that's part of actually being transparent. Again, there are countries that are already doing this, Australia, New Zealand, Canada, UK, actually, and in fact, the EU, they have to publicize when they meet with the industry for what purpose and the outcome. And it's a very easy administrative measure. You don't have to go to Parliament to do that. The various departments, you just, on your website, you can just have an icon that actually tracks this and you've got to keep it pretty updated. Finally, the third point on CSOs, point well taken by our colleague who talked about the importance of civil society itself having a position on Article 5.3, and I think that this is an absolutely important point, and I want to stress on it that groups like VAST, the NCT Alliance, when you already do it, you actually have on your website, you publicize your Article 5.3 policies. It is, I think, just logical that NGOs working on tobacco control need to have our policy on 5.3 up on our website before we can talk about it. It's a very simple requirement. It's just a short paragraph that you can put up on your website that you abide by Article 5.3 and you do not collaborate or receive any funds from the tobacco industry. That's it. You just have to put it very simply on your website to ensure that you are abiding by it so that you can set the standard for the government. So I think it's very easy to do that, and you should do it immediately. And then there are other websites which actually provide who are those NGOs that have links with the tobacco industry. I mean, GGTC has got a list of industry actors. Tobacco Tactics has got very good write-up on who are those NGOs or those individuals or consultants or think tanks that are linked to the industry or receive funds from the industry. All of that is actually available on these websites and also on the STOP website. So there's plenty of information out there, and I hope that you'll be able to use it. But please do contact us if you need further details on any of these points that I have raised. Thank you. Over to you, Caleb.
Thank you.
Thank you very much. Thank you. So I think the first question I'll talk about is with regards to the multi-sectoral team that I talked about. I think the person who asked that question probably didn't quite understand what I was saying. it's not a multi-sectoral team of the tobacco industry. It is rather a team to monitor and expose what the tobacco industry is doing. We're talking about the necessity to have such a team functional in the country. We call it the Tobacco Industry Monitoring and Response Team. And I said it needs to be multi-sectoral because the tobacco industry can infiltrate in several through any means, any sphere. It could pass through the Ministry of Agriculture, it could pass through the Ministry of Commerce, it could pass through the Ministry of Communication, it could pass through customs, it could pass through any department, any domain. And so the more we have people within these various sectors, including people, representatives of the media, including CSO representatives, including customs, taxation officials, law enforcement officials, crime and investigation authorities or units, state crime and investigation units. All these layers of authorities, people, agencies that could potentially have access should the tobacco industry maybe ever attempt to meet a government official and who can, of course, always share information together. That is what we refer to as a tobacco industry in monitoring and response team, and that's why we say it needs to be multi-sectorial because the wider the scope of the team, the better our ability to catch any case, any possible attempts to infiltrate government circles. I think the second question is on what is being done at the regional level for such a multi-sectoral engagement to support or to monitor activities of the tobacco industry. Well, at the level of ATCA and at CSO levels in my presentation, I talked about the creation of 15 tobacco industry monitoring and response teams across the continent. These teams were formed over the years by ATCA after rigorous trainings in the various countries. It's a progressive measure. Of course, as we get more funding, we're able to train more teams. We're able to train advocates in more countries and create more teams and make them as multi-sectoral as possible. At the moment, we have this as a regional team. The members of the 15 country tobacco industry monitoring and response teams constitute another group, which is a regional tobacco industry monitoring and response team. At the moment, it might not be perfect, but at least we are able to occasionally identify interference cases, and I do acknowledge that we need to strengthen such initiatives
All
to
right, so
expand
can,
them across the continent.
can you hear me?
Yes,
Yeah, so we are pressed with time. And so what we'll do is probably we'll have to reach out if we have further, questions. Or probably if you want to share further response, you can do so probably with our colleagues or Labron so that we can have some of these responses, documented in our report. I would want to use this opportunity to thank you so much and Mary for being part of this strategic event and sharing this wonderful insight with us. Thank you so much. We want to go on a break now. For those of you joining us via online, we'll be having 10-15 minute break. If you can, probably also take a break wherever you are and join us later. Thank you so much, and we are really grateful. All right. Okay, so we want to have. Thank you. You're welcome. We want to have 10 or 15 minute break, at least by 12:5. We should be back to continue. The rest will be done by local people in Ghana, so we can manage it here. Thank you. Yeah, so the food is outside. Let's go outside. They don't actually advise we eat in this room, right? So we can do it outside. Thank you. The next session of items, hopefully by the next 45 minutes, we should be able to end this meeting. Thank you so much. All right, so when the event started with this self-introduction, there were some few people who just joined us. We want to know who they are and where they are coming from. So, Winston, if you can get, yeah, Mr. Jeff and then Dr. Combat.
Thank you for the opportunity. I'm Alex Combat from the Ghana Revenue Authority. Thank you very much.
Thank you. You're welcome.
My name is Jeffrey Okansi from RMA.
All right. Revenue Mobilization Africa, you were duly acknowledged in your absence for your active participation, contribution, and insight into the index that we are about launching in some few minutes. All right, so we continue with our next presentation. That's the background of the index and methodology for the Ghana 2025 Tobacco Industry Interference Index. And to help us navigate this session is our own colleague and brother, Godfrey Chinubu Akodia, the Research and Policy Manager at VAST Ghana. Godfrey, let's have you take us through your session. Thank you.
Thank you for the introduction. And I want to thank everybody for having the time to join us for this important discussion. I think since we came here in the morning, from the videos we've watched, from the presentations we've had, I think we've had a good background of what the Article 5.3 is, what the regulatory framework is. I don't know if I should do a small quiz, because I think the first part of this presentation looks at the background, which we've had an extensive insight of. So should I do a small quiz, or would you guys want us to a small one? Okay, so Chris, you've been very, very vocal this morning. Oh, I think from the passion you spoke with today, I think it's right for me to start with you. Then I can actually move on to other. So I think if you can just give us a brief background as to why do we even need Article 5.3? Why is it even very, very crucial for us to be very, very diligent when it comes to Article 5.3?
Thank you. In my own words, I believe that Article 5.3 not only limits but deters government from engaging directly with industry. It also puts up structures to ensure that they are very transparent in how they interact. So, for example, we've heard about how they put information out that this meeting may be going on with industry, and at the end of the day, come up with some sort of a report as to the purpose of the meeting and how it ended. The article also puts CSOs, NGOs, stakeholders at that point where we believe whatever it is that government does with regards to, let's say, illicit trade, we are also aware, just as Mr. Jeffrey mentioned, and I believe Madam Mary, if I'm not wrong, also acknowledged that CSOs would also have a part to play in ensuring that some of these things are not happening or are not done under our very own eyes, and that it's not just the government every day. And so this, I believe, would be my contribution to that.
Okay, thank you. Chris, choose one of the ladies so that I just pinpoint the question to.
Okay. I think I like this one. I'll choose Baba Sam. Thank you.
Okay, thank you very much. Baba Sam is one of our, those gender advocates. So I think looking at the industry, what particularly have you seen about the industry that you think is very, very crucial that they should not be part of public policy making processes?
Um, I think that industry has the resources, and so the question again.
What have you seen about the industry? What do you know about the industry that you think that is crucial? We do not involve them when it comes to
Okay.
public policy making
Okay.
process.
Okay. So I think that they have the resources and the influence to water down the policy development process. And so it is very crucial that we don't even allow them in the first place to be involved because they have the capacity to water down every policy if we allow them.
Okay, thank you very much. So those of us who came early, who saw the video that we watched this morning, I think later in the day we also saw the video again, looks at how deadly an industry is for that is. So why should we even let an industry which is killing us be part of the process in the whole place? So I think based on our quiz, I think we can skip the first part of the presentation and then we can look at the methodology of how the industry came to be. So now the industry is based on a questionnaire which was developed by the Southeast Asia Tobacco Control. We have 20 questions and we are going to go through the questions to understand how we're able to gather the data and come up with the index. So the period we look at the information and the data was between March 2023 to March 2025. So everything you're going to present in the next presentation looks within this year period. Now we had several indicators. So on indicator one, we wanted to understand how have industry been involved in policy making processes. And that what we had to look for was that has the government accepted us or support or endorsement from any assistant or in collaboration with the tobacco industry or its entity. So we had to go online, look for data to even know if the government in any of its policy decision processes did anything with support of the industry. We also wanted to know whether the government has endorsed any policy that the tobacco industry is pushing for or in any of these cases. When it comes to indicator two, we look at industry CSR activity. We wanted to know the industry in conducting their CSR activities, the industry in making their donations and things. Have any of these donations made it hand into government? Has government endorsed or even come into partnership with the industry or its ally in making all of these CSR engagement? We also want to know whether government members, their family members, or have even received any contribution. So we had to go the extra mile to go down even their wives, their children, and other things to see has any of them even received any contribution from the industry. The third indicator looks at the benefits to the industry. So you want to know whether the government has made any incentive, any requirement, anything that would directly or indirectly make sure that the industry benefits in any other way. Has the government have policies in place that indirectly, maybe directly, it may not seem like it's actually for the industry, but indirectly will actually benefit the industry. Now, forms of unnecessary interaction. So now we have to look to make sure that now this is some part sometimes the most difficult part. Looking at meetings, conferences, the events the industry holds and any other thing, whether government representative represented in any of these events. Does the government even accept assistance from the tobacco industry when it comes to enforcement? Within this year period, that the government even endorse or even enter into partnership with the industry. Now, transparency, we want to know when government is dealing with the tobacco industry, what happens in there? Is it transparent? Is the public aware of that? Has the government even met the industry within this year period? What happened within the meeting? What was discussed? Were there minutes? Were there pictures? Were there reports or any other things? We want to know. Then the sixth indicator is conflict of interest. So we know we have a very large public officials here in Ghana. So now we have to go through every single public official and their family to make sure that do any of them have any link to the industry? Do any of them have any positions to the industry, whether present or past? How does it even affect policy decision-making processes? So we even look at those who have retired from government. We look at their families and anybody associated with them if there are such kind of interest there. Then we look at preventive measures. We want to know, has the government put in place a program to prevent any industry interferences? Does the government have even programs to even build the capacity of public health officials in this um, area? Does the government even have a code of conduct to prevent industry interference when it comes to some of these policy decision-making processes? And other two indicators we didn't look at previously that were added within this index. When you look at Article 5.3, when you go to 5.4, it says that parties should have some kind of legal penalties when the industry presents any misleading information. So does Ghana have a legal backend that stated that if the industry, one way or the other, presents any misleading information to the public or to the government, can there be sanctions against it? Then we're also looking at the cage resource database. Basically, has the government have a database where all industry-related activities are centralized at one place that can be easily accessible to the public? These are the other two indicators that were added this year that we had to look at. So basically, this is the method, and these are the things we had to consider when we were looking at developing this index report. So we had a very extensive research, data gathering, looking at some of the things we had to consider. We had to go through a whole lot of websites and doing background checks and other things. It was very, very comprehensive in order to come up with this index. Thank you.
Thank you very much, Godfred Chinibwa Kodia, affectionately called Tiki. One of the hardworking guys I have met in my journey on this advocacy effort, especially on NCD and tobacco control. Thank you so much once again, Godfred. All right, so we have a special case. If you check on the program itinerary, there's a section for short statements from partners. We've been spoken to, and I've gotten confirmation or heads up from my boss that the NDPC have another meeting which is some few minutes away, and so we would want to give them the opportunity to share their short statements, after which we will take the keynotes, the recommendations or findings from the report, and then we'll open the meeting up for other things, while we also request the MOA to officially launch the report. So let's have the rep from NDPC to give us their short statement. Thank you. The clapping doesn't come at all. All right, thank you.
Usually in nutrition meetings, if the clapping is not good, they say it's anemic clapping. This one, I think you are tobacco-induced clapping. So good morning, everyone. I do apologize for rushing this part of the program. Generally, I should have left at 11:30, but I've tried to stay as long as possible. This is a very important topic, and by no means am I trying to leave because I don't feel this is important. I know Labram is somebody who's very passionate about this topic. A couple of years ago, just to set the tone, we received a letter of sorts from one CSO at the time. I cannot remember the name of the institution, but I would not be surprised if it was Labram's institution, on e-cigarettes. My Director General at the time asked me to respond to the position of that CSO. And obviously, the whole debate around e-cigarettes, how ideally it should be used for medical purposes to help somebody who's addicted to tobacco to move away from this tobacco addiction. And as I was doing the research around this issue of e-cigarettes, my colleague Emmanuel can testify, there were pros and cons for this whole debate around e-cigarettes. But ultimately, the issue was, how do we control people from abusing the e-cigarettes in itself? And how do we ultimately stop people from even using these kind of products in the first place? I don't need to belabor the issue, but we all know. Just go to the beach on a Saturday. And we see the young men and women living life, enjoying themselves, smoking shisha. Go to Oxford Street any night. I think there's a whole shop called Shisha something, right? Shisha Lounge. Having fun, thinking they're really living the life. So it's a lifestyle issue that is going to have implications on policy, on government budgets, on the health outcomes of the nation. And so as NDPC, this is something we do take seriously. And I'm now formally going to read my speech, but just to let you know, it's something that we do take seriously, and we, along with our partners within government, Ministry of Health and others, it's something that we do pay attention to. I must say this though. I'm a man who has had the privilege of traveling the world. I was actually born in Nigeria. I'm a Ghanaian, don't worry. My dad was working in Nigeria at the time. Ghana must go, forced us to come back to Ghana. Then he didn't really like what was going on. So we moved to Zimbabwe, Botswana. I stayed in Zimbabwe for 22 years. And Zimbabwe, as you may or may not know, is the leading producer of tobacco in Africa. Probably top 3 in the whole world. Massive, massive production there. My cousin who's still there is actually the CEO of the biggest tobacco company there. It's very funny because when we were growing up, smoking was a no-no. My dad would beat us if we even thought about it, and yet that is where we find ourselves. But just to put it into perspective, tobacco is so freely accessible in that country, so easily accessible. When I came to Ghana, honestly speaking, it took me about 6 years before I saw anybody smoking in this country. I was pleasantly surprised. I'm like, what is so special about Ghana? Why? Is tobacco, like, you guys, are you fighting tobacco or something? It was later before I realized that there's quite strong regulation around it, but I think the social taboos around it also contribute. But I have noticed in the last decade or so that, especially amongst the younger generation, that social taboo is slowly fading away. And it's something that we need to pay attention to. And so I think such reports, such attention being paid to tobacco and other things around are very relevant. So representatives from VAST, NCD Alliance, colleagues from ministries, departments, and agencies, academia, I'm not sure there's anyone from academia here, and other relevant partners, distinguished participants, ladies and gentlemen. On behalf of the National Development Planning Commission, I would like to thank Vision for Accelerated Sustainable Development Ghana for convening this stakeholders engagement to launch and disseminate the Ghana 2025 Tobacco Industry Interference Index report. Tobacco use continues to pose a significant public health and development challenge. Its impact goes beyond health outcomes to affect productivity, household welfare, and the sustainability of national health systems. Addressing these challenges therefore requires strong governance arrangements, effective regulation, and sustained policy coherence across sectors. The Tobacco Industry Interference Index provides a useful evidence-based mechanism for assessing the extent to which public policies are protected from undue influence by the tobacco industry, consistent with Article 5.3 of the World Health Organization Framework Convention on Tobacco Control, Such assessments are important for strengthening transparency and accountability in public policy processes. From the perspective of the National Development Planning Commission, the findings of this report are highly relevant to Ghana's national development planning architecture, particularly the priorities outlined in the current medium-term national development policy framework, which runs from this year, 2026, to 2029. Within the framework, government has identified Objective 2.3.4, which is reduce incidence of non-communicable disease as a key national priority. In pursuit of this objective, the medium-term national development policy framework outlines important strategies, including increasing taxes on tobacco, alcohol, and other unhealthy food products, as well as strengthening the effective implementation of the WHO Framework Convention on Tobacco Control and its protocols, in alignment with SDG targets 3.4, 3.5, and 3.8. These policy directions reflect government's commitments to addressing the growing burden of non-communicable diseases through preventive and regulatory measures. In this regard, efforts to limit tobacco industry interference in public policy processes are essential to ensuring that these national strategies can be implemented effectively and without undue influence. Evidence generated from this index will be useful to provide valuable insights that can support the implementation and monitoring of these national policy commitments. By contributing to strengthening transparency and accountability in the policy-making environment, the index should help us to safeguard public health policies that are critical to achieving Ghana's health and health services objectives. Ultimately, reducing the burden of tobacco use and non-communicable diseases is vital not only for improving population health, but also for advancing Ghana's broader development aspirations. A healthier population enhances productivity, reduces pressure on health systems, and contributes to sustainable and inclusive national development. The Commission therefore welcomes the opportunity to engage with stakeholders on the findings of this 2025 Index report and wishes to reflect collectively with all of you on practical steps to strengthen institutional safeguards, policy transparency, and intersectoral collaboration in addressing tobacco industry interference. We commend VAST Ghana and its partners for its relentless pursuit of advancing evidence-based advocacy and accountability in tobacco control. The NDPC remains committed to working with all stakeholders to ensure that Ghana's development policies promote healthier populations, strong institutions, and sustainable national development. Thank you very much.
I don't know. Our class looks very weak. Yeah, let's clap. Yeah, I love that. At least once you don't have the opportunity like I do, speaking through the microphone, the least we can do is to share a shikbo. And I want to tell a shikbo. Chodi. Abuganu, who ya agnawani. But shiki nabuganu in Hausa. I'm a man of many colors. I'm a Nima boy. Yeah. I remember one day I introduced myself at Christ and Police, Ottawa. I said, Ottawa, I'm Solomon Foley, the Nima boy. Come and see the man. He laughed and laughed and laughed and laughed. All right, thank you very much, NDPC. That was very great. I really enjoyed your upbringing from Zimbabwe and the experiences. They are very good. Your cousin chose to work with the industry because of Kwacha, Kudi. Yeah, it's obvious. But you have decided to work with NDPC. It's all good. All right, so let me welcome once again my boss to share with us key findings and recommendations from the Ghana 2025 Tobacco Industry Interference Index. Very important. Abraham, let's have you to share some of the key findings from the report with us. Thank you.
Yes, thank you very much. And let me just say that indeed, from your presentation, you alluded to the fact that you have no doubt that the letter will come from our end. Indeed, that letter will not come from our end. It definitely will come from an industry-aligned, group. We call them the Harm Reduction something of Ghana, right? Yeah, it's the Alliance of Ghana. So there's a group in Ghana currently, which is a civil society organization. That's what Jeff alluded to, the fact that they are also their civil society group who are also pushing for government to accept or to incorporate harm reduction strategies in our policies, so that they get the opportunity to allow e-cigarettes to come into the country and for our youth to smoke. And indeed, I've always said that for that probably led to the GRA maybe taxing e-cigarettes. But currently it's a lacuna. We have a big issue in Ghana where the Public Health Act strictly bans e-cigarettes. But if you go to the GRA Act, if Dr. Kumar comes, you have the opportunity to explain. you now have the GRA taxing the product. So also misuse. So now you have two laws. One is banning and one is also accepting taxes. So when GRA confiscate the product, when the GRA allow them to come and take the money, then FDA will go and then confiscate them. So yeah, so we are trying to see how that can be addressed holistically. But trust me, there's a force in Ghana here today that is working with some tools that organization and promoting harm reduction. And I asked myself, what's harm reduction? Ghana have tried, and I'm happy you said when you came back from wherever you were to Ghana, you noticed that the smoking rate was very low indeed. The prevalence of smoking in Ghana is less than 5%. Nigeria and Co are struggling with I think 13% or something. We are blessed with that. So, and what did we do to get that stage? I don't think that we employed any harm reduction strategies. We effectively implemented the WHO FCTC, and that has made us got to where we are. And we don't have problem with smoking in Ghana. And when we talk about, e-cigarettes, normally they will say that it is to reduce the extent to which people are smoking, or people are smoking the traditional ones, which are very deadly. But research has shown that even e-cigarette also contains some toxic chemicals that we don't need in our part of the world. That said, we don't need e-cigarette to reduce smoking in our country, right? We need the WHO FCTC, which we have implemented. To this extent, and we continue to urge everyone, including policymakers, not to buy into the idea of this industry, allowing people they get the money from the industry people to push that. In fact, so if you read the report, we have documented, all of this in the report, including some of the activities they've been doing in Ghana and some of the policymakers they've been engaging, because these are public records. And everything in the report here are verified. They are reports that we have gotten through our research, and that has made us to come out with this report. Right, there are some names that have been mentioned, specific names, who work with some government agencies, who claim they are researchers or big time directors who are pushing this harm reduction. For the interest of they themselves and the interest of the industry. Right. So I'll move straight to there. So just explaining that before you take your leave. Right. So so my presentation is going to focus on. Am I right on that? Yeah. So I'm going to look at the key findings. Briefly. So what is important for us to note is that on records as of today, identified tobacco industry groups in Ghana. These are the tobacco industry groups, and also that are in Ghana today, or tobacco industry. Is it groups, tobacco industry players, or those who import tobacco products in the country? Yes. So here they are. I think this thing is not correct. The heading is not correct. So we are the top local tobacco groups in Ghana. So BAT is number one. Looking at the imports of tobacco products in the country, right? As of now, from WHO records, right? So we have British American Tobacco, which is BAT. In fact, they're the main importer of tobacco products into the country. And then we have, and they import products like Rothmans of London, Menthol, Palmore, and then you can see those there. And then we also have Target Link, another company that also imports tobacco products. So they import the Oris Red, the Oris Green, Gold Seal. So these are the products we have in Ghana as far as tobacco is concerned. Then we also have Barry International Company Limited. And then so here they are. So we have quite a number of companies or industry that produces products and import them to the country. Right. So in terms of sources, this is where we got them from. These are all from WHO as far as this list is concerned. Right. Where's that question here, right? I could not find it, but when I came, it's not coming. Okay. Okay, right. So in terms of indicators, so this have been said already. So I will not belabor the point. I will just pick the specific ones now. So please, can you see this? Can you see the at all? You can, right? Okay, I think it's a bit dim, right? Okay, so the level of industry participation in policy development, which is very, I think it's been spoken about already. I won't belabor the point. So looking at to what extent, has the industry participated in policy making processes, right? So you see, a typical example was what he mentioned, the fact that they reach out to policymakers to see how best they can involve in the process of developing policies, especially the fact that now there's an open door where government is now trying to review the Public Health Act, right? And the Public Health Act also includes tobacco control measures. And they know there's a provision that bans, e-cigarettes. So they will try to infiltrate to see how to disabuse, to create an environment where government will accept this product by giving them fake research findings and all of those things from universities, from wherever. Because indeed, they always have a reference they make in Sweden that Sweden has one of the best. Is it Sweden? Yes. Right, Sweden has one of the best, results from e-cigarettes or from these harm reduction strategies. The fact that Sweden has one of the highest prevalence of smoking in their country, and mostly are the youth, right? So they introduced the harm reduction, and they said that that intervention has failed to reduce the intake of traditional cigarettes. So the prevalence have come down because they feel that traditional cigarette has, but what we are saying, that research is also showing that even the e-cigarette it's not as safe as we want to believe. We don't want it, right? Anyway, we don't want it, right? Okay. So you could see that because so in Ghana, we have documented there is no direct evidence that the government of Ghana has formally accepted, or supported or endorsed assistance from the industry, meaning we have not yet done that, right? So meaning every policies, the industry has not been involved. And then there's no evidence to suggest that the government accepted or approved, or supported policy legislation in all of this. So there's a tall list of issues that shows that indeed Ghana has not necessarily directly, gotten support from the industry in policy formulation. Now, but if you come to the other side, it says that industry promotion and influence. Now, the point is that, however, the industry organization have actively, promoted. I can't see. Can you turn this towards me a little? Even I'm moving closer. I'm not even seeing well. Right. This one, the Godfred, is it's definitely your fault. Yes. Okay, so I can see from my screen here. So you managed to see from that, please, right? Right. So, so whilst he work on the front side, right? So, on the point we're trying to say is that yes, though there hasn't been direct involvement, and we are saying that industry allies, just as I mentioned right now, the fact that industry allies have actively promoted narrative around harm reduction, right? The harm reduction is the e-cigarette that we see around us nowadays. And then the fact that they want government to accept vapes and e-cigarettes. Now, the inclusion of e-cigarettes, which is very, very important for us, that's what we believe, that the inclusion of e-cigarettes was as a result of the propaganda or the active lobbying of the industry, that made that happen. But the GIA will tell us that it was their own intervention that made them to impose taxes on this product, because they feel that the product is in the market. So why do we allow products in the market without taxing them? When Dr. Combat comes, he will give us more in-depth as to the reason behind why the GRA imposes taxes on e-cigarettes. But from our point of view, we feel that around the time when we're doing the advocacy, the industry allied groups were also actively holding press conferences and then engaging other stakeholders, because they knew that around the time government was going to implement tax measures. So they also find a way, because I'm told that the FDA on a number of occasions have refused to engage them with their harm reduction strategy, right? So they have to find another strategy. Now, the next slide. Now, the industry CSR, which is corporate social responsibility activities, which is also very key. The industry pride on that a lot. So the industry would always want to use measures like corporate social responsibilities I mean, as a way, and that's what they've been doing most of the time. I think when someone was speaking, he mentioned the fact that if you are in need of money to go to school and nobody will offer you, and the industry is there to offer you, will you take it or leave it? That's a big question that you have to. I mean, we have. To, I mean, we normally, I mean, struggle with. But the point really is they do these things so that people will see them as a good corporate entities, right? Supporting the vulnerable, supporting the. But the point for us is that the benefit is very very minimal. The harm is huge. So can you imagine supporting one person to go to school and let the whole world know that they are supporting government to do recruitment or to save people who are unable to go to school, but at the expense of getting more people to now smoke their products. So the cost benefit analysis is not it's not the best for public health, right? So that's what government must be looking at it, not the short term benefit as against the huge effect that it has on the population. But currently, I've always maintained that the industry are just few individuals, few of them, but millions of people are smoking the products and millions of people are having the disease. So they are profiting over the deaths and then the poverty and of us as a people. So we should be mindful of that now. So it says that the Africa Center for Entrepreneurship and Youth Empowerment, an organization known to be funded by Atlas and Atlas Network to advance its free market campaigns, has recently launched the George Aite Society, which is expected to nurture a growing network of liberal scholars across the continent and stimulate new and exciting scholarship to advance free market initiatives. So this is what they do. It's a clear example of what I've just mentioned. So this is a group that receives money from Atlas Network, and Atlas Network is a known recipient of tobacco industry funding. You understand? So they get the funding, and then sometimes it's not very direct. It's very, very difficult to know that, because they know that when people get to know, they'll be exposed. So they work through many, subtle means. So before the money gets to me, maybe I've gone through a lot of about 5 people already before it gets to me. So you wouldn't even know that, and I'm the one who then eventually come out to do the work. So you wouldn't know that the money is coming from, or it's coming from the industry, and this is what they do. Right. So we need to be very mindful of that. And just as other speakers have spoken now, benefit to the tobacco industry. So are there any benefits to the tobacco industry from Ghana perspective that the industry have benefited? Indeed, governments sometimes will give them concessions, right? Sometimes when they are importing products, they give them waivers and stuff. And we have a similar situation in a country when, because Ghana is within the ECOWAS sub-region, we are exempted from certain taxes, right? Import duty. So the point is that because it's a good that's also moving within the sub-region, they're also exempted. But what we are saying is that tobacco and other substances should not be exempted for any reason, right? They should take it out of normal goods, because it is not a normal good. It's a product that kills, irrespective of how you use it. Now, so there's no evidence that the government of Ghana has accommodated requests from the tobacco industry or for extended time frame or postponement for the implementation of tobacco control laws. Now, however, per the tax law, a 3-month transition period is required. So that's our law. A 3-month transition period is required, right? For full presentation of excise taxes when introduced. And this is something that we think that we need to be amended, because that time is too much. It will give the industry the opportunity to do whatever they want to do, maybe bring in more productive country. So we need to see how we can strengthen. And that's what our research have gathered. I know, and Dr. is looking at me, probably he will make a note, but it is within the law that 3-month transition period is required for full implementation of excise taxes when introduced. Now, this was noted in the Excise Duty Amendment Act 2023, which was passed by Parliament on the 31st March 2023 and implemented as scheduled to begin by 1st May. Meaning they went through the 3 months period, which we think that we need to work on. Now, and then if possible, give them maybe just 1 month, to face off new products, stop bringing other products, right? So that we can have a better regulation. Now, and then what Ghana is not, next slide, what Ghana is not, what Ghana has not issued direct subsidiary or industry-specific intervention to industry. Certain general trade policies provide direct benefits. So there are direct benefits. So the point is that government does not give them direct benefit. Maybe take this money, but see, but indirectly they benefit from other things, right? So once you're able to understand this is a benefit to the industry. So for instance, a long transitional period is a benefit to the industry, right? To do whatever they want to do before, the main regulation take effect. So under the Global Express Association, the diminishes threshold against value to um, under the Global Express Association diminishes threshold goods value up to 3,200 Ghana, that's 200 Ghana cedi are exempted from excise duties. Maybe the government have to verify this one. So you see, goods that are above, there's a threshold. That if it's below certain threshold, they are exempted from excise duty or taxes. Now, so you can read more on that. But the last point says that furthermore, Ghana's custom regulation allow international travelers aged 18 and above to bring in specified quantity of tobacco products duty free, about 200 sticks of cigarette free, without having tax on them. Now, and then contribute to further to the affordability and accessibility. So if I'm traveling with 5 kids who are all about 18 years, I can buy cigarettes, which about for all of them. And that one you can and duty free is quite something very cheap. So you can buy them and bring to the country. And those one will not have the Ghana's warning. It doesn't matter. It's not supposed to have maybe sold in Ghana alone. You can buy it from Azerbaijan or whatever, provided it is through the airport. You can bring it to the country. And when they come, people normally even sell them. I remember some years back, we have places where they sell foreign products. If the FDA goes there to go and consider, say, no, this one is alcohol, but the point is that you're not supposed to use them, you're not supposed to sell them. It's for personal use, but you now find them in shops where they sell them, and because they are foreign products, and because of these allowances. So we are calling on government to ban that, so that you buy them, you pay the appropriate taxes before you bring to the country. So this is our benefit to the industry. Now, I don't know what even brought the idea of even doing that in the first place. I just don't understand. But it's been there for years, and we're hoping that with time, and Ghana government will ban that now. And a form of unnecessary interactions. So sometimes industry interact unnecessarily with government. That's why in a previous presenter, Ms. Sunta said that government should ensure that there's no unnecessary interaction. Don't even interact with them. Only interact with them for the purpose of regulating them. So okay, if I want to put taxes on you, come and let this guy finish. But to have meetings with them, no. Those ones, the industry are so smart, and they would always find a way of influencing people, right? So a classical example that we have made severally is the De La Rue issue. But I know that with De La Rue is a company that's producing a Ghana tax stamp, right? And it has some direct link with tobacco industry. But we are told that currently government is also looking for other company that can help us to have a good tax stamp that's fit for purpose. So we are hoping that with time we'll have that, and then the industry aligned company will not be allowed to produce the tax stamp that you see on every product like this one. Like the water you are seeing on your team, for instance, the tax stamp is produced by De La Rue. And our research shows that De La Rue has some link with the article with the tobacco industry, right? And then transparency. Now, there's no public disclosure by the government of Ghana of meeting and interaction. That I have mentioned already. Whenever there's a meeting with FDA and the industry, you will never hear about it. Or you hear something in the meeting, and FDA will say, we've met the tobacco industry. So where did you meet them? Who was there? Or what was the agenda item? But the framework that we are sent onto clearly has specified that before you meet the industry, at least there should be some, public processes, so that we can make sure that at least those meetings are held without any, influence from the industry. Otherwise, there are many classical examples of happenings at the global level where industry tend to influence policy. Now, this lack of transparency is inconsistent with the WHO Act 5.3, which we are talking about today, right? And the tobacco industry, the tobacco regulation requires the registration of only the tobacco industry and product. However, it does not extend to affiliates. So the point is that if you're a tobacco industry, they can register you, as you can see on the screen. But if you're an affiliate, maybe you are a lobbyist, that one, but the law is saying that, or per the requirements from the FCTC, you are supposed to register every entity that is involved in the whether promoting the tobacco industry. They have to register them so they can account for whatever they are. So we also know that these are lobbyists, so that we know how to deal with them or don't deal with them in the first place. So that once they are classified, they don't even go and organize meeting for civil society or media to come and cover. You understand? Right. Next slide. So conflict of interest. Has Ghana reported any conflict of interest? Yes, there are quite a number of them. I'll just go straight to the last but one. There is evidence of former and current public officials holding position or affiliation with tobacco industry linked entities. Now, the immediate past Deputy Minister of Energy, Honorable Herbert Krapah, previously worked with the tobacco industry with the work with the British American Tobacco. That is they call this one the revolving window, right? Revolving window. You know what the revolving window is, right? And so you have a window which shows here and shows there, right? So you have your house in Aflao, and that house is sitting in between the border, right? If you enter in the morning, when you leave your house, you have gone to wherever, Dome. In the evening, when you come, you are in Ghana. You understand? So that kind of thing, right? So we need to make sure that we check those one. And then also, additionally, one Mr. Samuel Hunu, Executive Director of the Harm Reduction. So he's the Executive Director for Harm Reduction Alliance of Ghana, an organization aligned with the tobacco industry. Is also currently a current public office holder. He served as the chairman of the mental health nurses under the NMA as a district chairman of collective. So meaning he's serving in government, also have interest in promoting harm reduction. You understand? So it's a thing that we need to be watchful of, because this product is not good for public health. And where he sits is very, very strategic to influence, some of these things. Next slide. Now, so disclosure and conflict of interest. So with this one, I will just say that the government of Ghana, we have at least some aspect of it within the tobacco regulation, but how to do with the industry. But the Public Health Act have clearly stated that the Minister of Finance, the Minister of Health, in collaboration with FDA, should develop code of conduct for public officials. So that's why I mentioned in my opening remarks that the FDA is currently working on something like that to guide the conduct of all public officials, irrespective. It doesn't matter whether you work on tobacco, but all public officials, so that in your dealings with tobacco industry, you know how to deal with them, so that to spell out some of the things that you need to know, some of the things that you shouldn't do even when you want to meet with them, or if you want to meet with them, what are the things that you must do before you have a meeting with them. That's very, very crucial. The next slide. And then preventive measures. Are there preventive measures that government have put in place to ensure that this does not happen? Yes, there are quite a number, but it says that the civil society organization, we have tried to work with FDA and other government entities to conduct awareness creation on Article 5.3, because if policymakers don't understand Article 5.3 of the WHO FCTC, we will not be able to meet anything, or we will not be able to ensure that we safeguard public health policies from industry. That's why when you come to the food industry, you go to the alcohol industry, it's very difficult to actually regulate the industry. But for tobacco, it's been done because there's a blueprint, there's a document, there's a global convention that binds government or that direct government on, even if you want to engage them, how should they engage them. Now, Section 60 of the Ghana Public Health Act 2012 prohibits government officials from accepting any form of contribution or gift from the tobacco industry. So our Public Health Act has actually restricted policymakers from accepting gift. This includes monetary donation, policy drafts. So when you're going to draft policies, you are not supposed to accept any proposal from the industry, offer of assistance, no taking assistance from them, no sponsorship, no steady visit, because that's what they do. They can just fly you from here to Dubai and then go and have meeting with you. By the time you come, everything is gone. All you focus on is industry. So, however, implementation gaps exist. There is no established system for regulating or for regularly informing or reminding government agencies, officials, and their relatives about this prohibition, leaving them vulnerable to covert industry. So the point is that yes, these things are there. So they have to be reminded, public forum might be held. And I'm happy that for Combat, he now understands this thing very, very well. But what about those other officials who are the policy or decision-making processes? To what extent will they understand this? And that's very, very important. Now, the next slide is liability and then also resource and data. That's also something that we are not doing so much well on. But however, Ghana has not implemented measures to ensure public access to information on tobacco industry. So we don't have any portal where this thing happens. So we can easily certify it. When we go there, we're able to see everything about the industry. It's not there, right? And the fact that also we do not have much capacity, or even if you have, we've not implemented this online sale of unhealthy products. Like for instance, you hardly see product on shelves, right? They trade online. So we have the digital sales, the Temu, them, the online sales that people do nowadays. So that's where the delivery takes place. So somebody can be in his home and then order for e-cigarettes, and they'll bring it to those steps, right? But what we are saying, you can see a lot of advertisement online, which is very, very difficult to regulate, right? So that's what they are doing now, to get hook our children into all of this now. But it says that the government of Ghana, per the Public Health Act, there's a section which states that, when you violate these laws, right, you are entitled to pay at least 9,000 Ghana cedis, right, which is equivalent to 12 penalty units. When you violate, when there's a fine. But the point is that the FDA are always commend the effort because they would always confiscate or fine people or warn people. But the point is that we don't even know how much money they even get from the fine. At least that's the transparency we're talking about. I'm happy when the rep from NDPC stood here. He said that there's a need for transparency and accountability in whatever we do. So at least, why not? Every year the FDA can publish, at least from January to December, this is how much we've been able to confiscate in terms of volume, and then maybe in terms of the quantity, in terms of the cost, and then how much fines we've been able to get from the fines that we've been finding the industries who violate. All of these are not there, right? So we need to do more in this regard. Again, our Public Health Act have also indicated that only 30% of all the fines, 30% of all the money that FDA will receive from penalties, from fines, should be dedicated to tobacco control activities. In fact, as far as I'm concerned, and I'm working in this space for more than 20 years, yes, I've not seen FDA saying that indeed they've been able to retain this money. It means that we have plenty money that the Ministry of Finance or GRA must release to us to do our tobacco control. What we start calculating for 2012, not come back, so that they give us all the money. If you're able to know how much fine that the FDA has been able to collect from this. So all of these have not been implemented. That's why we are saying that Ghana is moving on a very slow pace in achieving our WHO FCTC. Now, the next slide. So this is the rating for Ghana. Somebody said 11 out of 50 something from Africa is not the best, which I agree with you, but at least we are better than the global. Now, at the global level, we are on the average. Now, this is the real statistic from Ghana. For the time we started the index, right, in 2020, we were ranked, or our score from Ghana was 56. That's what the score was. And then in 2021, so you see all the measures that government indicated, so all of them has a score. So when you do the research, then you score based on the indicators, right? When we did that in 2020, we scored 58, right? Meaning we are not doing so well, we are not doing so bad. just as Madam Assunta indicated. Now, in 2021, Ghana came down to 50. We improved by 2 points to 56. I've forgotten what led to that, but there was some intervention that government implemented. Normally, when it's a change, meaning something that happens. So, for instance, if Ghana is able to implement a code of conduct and pass into law, then your rating will go. I mean, we will improve, right? But if it does not, then we'll remain where we are. Similarly, in 2023, we now went back to where we were coming from. Yeah, because I mean, certainty didn't improve, which was expected after a period. And then God being so good in 2025, and we had some progress again being made by I think 3 points, which improved our score. Now, the country improved its score from 58 in 2028 up to 58 again in 2023. Now, in this recent ranking, however, a lower score of 58 indicates less interference, meaning we have improved in the extent to which industry was interfering, or lack of publicly available information, suggesting that while Ghana has taken steps to mitigate industry influence, however, significant progress needs to be made to get there. Right now, so some key recommendations from the report, which we would adore. I mean, at the end of the meeting, and then we will find them online for you to access. But you can find a brief of that, which has been handed over to everyone in this room. Now, it says that Code of Conduct, the Ministry of Health should urgently operationalize Article Section 18 of Tobacco Control Regulation LI 2247 by issuing formal. So the point is that we are calling on government to implement Article 5.3 in the context of as prescribed by the law which we have, because then the law will mention that this has to be done, but we need to take steps to do it, right? So there's a law which was passed in 2017, and now in 2026, up to now, that has not been done. So we are calling on government to do that. And I mentioned to you that there are efforts already underway for government to start, implementing that now. And then also, public disclosure. Government officials must be obligated to publicly report and disclose any form of engagement. As I mentioned, the FDA should start doing that. Once you do that, you are upholding transparency. You are ensuring that transparency has come to stay, and nobody is being left in the dark. So there's a need for public disclosure of all meetings, all money that are being realized from the FDA perspective. If they are not getting their money, so we can help them to do the advocacy to ensure that the 30% that is required for tobacco control intervention is actually dedicated to the FDA. Then excise duty revision. Now we are also calling on the government of Ghana through the Ministry of Finance, probably working closely with the Ministry of Health, which a representative is here, to see how best we can ensure that e-cigarette and e-liquids are excluded from being taxed. So that as Ghana, we know that e-cigarettes are banned and are banned outrightly. The report there shows that Ghana have banned e-cigarettes only for medicinal or whatever. But the point is that we even need to review that, whether there's an absolute ban on it without anything like maybe for medicinal and not for recreational purposes. But we can only do this if we come together as one: Ministry of Finance, Ministry of Health, GRA, and all other key stakeholders. And then industry transparency. Now, the tobacco industry is required to publicly disclose comprehensive. We are saying that the industry should also be allowed to disclose of every information that they are into, because many of the information are not available. We struggle to get them. If today you go to the tobacco industry website in Ghana, you don't find anything there. Nothing is there. There's nothing about Ghana. So how do we ensure that they publicly put the information there? Maybe we can use the right information bill to subject them to do that, because they are registered entity in Ghana. I hope the media people are listening, that we can work together on that now. And then the issue of regional fiscal reform. There's a need to start regional discussion to examine or amend current fiscal measures that indirectly favor the tobacco sector, such as the FOB, and then also the discount that they get duty-free allowances at the ECOWAS level, and also exemption from from import duties for tobacco goods. I would like to thank you very much for your attention, and thank you.
Thank you very much, Abraham Masaudi Musa. I think probably in our next meeting, I will see an improvement in terms of the timing. Labram does formally don't do well when it comes to timing. There was an improvement somewhere the last 2 quarters before we ended the year, and early this year he was doing well as well, but I don't know why he wants to go into his old self. Oh, okay, all right. So, thank you, love. All right. So, before I introduce one person in our midst to do the lunch, would want to have a short plenary session. Probably there are burning issues, or probably from the first presentation, Marazunta, Caleb Ayong, Godfred, my boss, and Abraham as well. Is that something that is pending? All right. So, Jaishi, can we help? Yeah, so let's bring the issues out now. A lot of things were mentioned. How do we advance?
Okay, so thank you very much. My name is Isaac, and I had a couple of questions I wanted to ask. First and foremost, I wanted to ask Mr. Labram that is it only Ghana that gives diplomats free exercise tax products? Is it only Ghana?
Duty free?
Duty free products.
Okay.
Is it only Ghana?
All right.
Yes, I want to be sure on that. And secondly, you mentioned of ex-government official that is, but we all know of Kojo Oppong Nkrumah that has worked with British American Tobacco for many years, has served on his board, has gone, but I don't hear anything about him. I don't know if maybe there's, because the last time I read on some articles on British American Tobacco and his name came up. And I don't know if you can maybe tell us something a little bit about that. Okay, sir. And on e-cigarettes, so I have these guys, the harm reduction guys coming after me these days. She have been posting on Facebook, and they are trying to convince me so hard. And the guy, there's this one, I want to pinpoint him straight. This one guy is on Facebook, and he's called Charles Gardner. And I know he's a front group, he's a front now. He has been doing bantering with me, and he's trying to buy me. I don't know. He's now giving me statistics that the US FDA is now telling them that vapes is solving their smoking problems there. Giving me statistics every day, sending me, and anytime I post, you come to counter. We do that on LinkedIn a lot of, and so I want you to, I don't know if it is true, because when I read on the US FDA, their sites, there's a lot of, I don't get the information clear there. So as you are here, I would like you to rectify that for me. And I think, as you said, sorry, I want to use this opportunity to commend GRA, because I always backlash them that I don't see them confiscating the products. But I think for like twice or second time, I've seen them. And these days, I've seen a lot of tobacco product that we've seized. But it's just that sometimes the end product we don't hear and we don't see the punishment. And as we said, name and shame. We hear about 30 trucks of cigarettes, but we don't know the owners. We know that the companies that they are bringing it from Togo. So even though I use this opportunity to comment with GRA, I want to see sometimes when the information comes, we should name and shame, so that when we stand in public, we can know that this man is the one doing the smuggling. And as my champion chairman said, I think it is time that the government should also invest in tobacco control a little bit. some institutions like mine, Jaishi Youth Initiative, we are a youth organization and we lack funding. You write proposals for awareness creation, awareness school, youth gathering, and all that. And your donors will tell you that we don't fund awareness creation, we don't fund engagement to schools. Your government needs to do that. We are paying taxes. We are giving the government about 600 million cedis. We are giving the government 700 million Ghana cedis a year. Yes, that's how much. 400 million. If I should add two, you will come and say it. So if I am giving your government 700 million cedis and your government cannot use 10 million cedis to tell the people that even though I am collecting 700 million, this 10 million is your insurance. When you get sick, go and it's very bad. So I think that is where the conversation has to start. So if government can also play their part to in tobacco control, we don't have to always wait. If VAL don't wait for ATCA and GTA to give us money and we are waiting for FDA credit didn't come. You see, then this meeting will not even come on. So as a civil society, I'm talking from a civil society. When you talk like this, government organizations don't like. So I don't work for government. So I am talking as a civil society organization. I think it is time that the government should also invest in itself and its people so that the donors don't make it look like.
Thank you very much,
Thank you very
Daishi Isaac Ampumachinyo. Thank you so much. He's been very frontal when it comes to some of these issues. Any other comment? All right, so
Chris, you talk first.
Quite a number of things to say. Thank you, Labram, for the work you do and for always bringing us on board. My question to you will be, what part or what role are we going to play in terms of the data that has to be gathered, for the index, the work of the index itself? Because I would have wished I was even part of the work you did to bring about the index. Sometimes it also helps with experience when VAST or Ghana SD Alliance is working on something, bringing us on board will be very, very beneficial. I also want to acknowledge you. So that's my question, but I want to acknowledge what you did at the beginning. The movie you showed, Boston Legal. You and I are fanatics when it comes to movies. But what we do is we don't just watch for entertainment. We watch to understand the climate or the scope of things that are going on in terms of writing and what people are trying to push. Because, like it or not, there's a lot of agenda when it comes to even the entertainment industry. They use it to push agendas within a certain time space or time period. If you pay attention, you would know. And when I watched it, I was pleased. I didn't even know that was the angle, but I was pleased. Because more often than not, you see some of these things in movies, you take for granted that, it was just a banter. But the man was speaking to a larger issue. I have watched Suits. I have not watched Boston Legal. It has been in my to watch list. But just because of this, I'm now going to go home, sit down, and then begin to binge watch it. I believe this is one of the biggest ways we can increase public knowledge about some of these things. I am a direct victim of tobacco use as we speak right now. Forgive my French, but I have an idiot of a neighbor who has shisha in his room. And I have lived in Labadi before. I have lived in the ghettos before. It was in the way any care I'm Antonio Michele. But I'm a taboo share me. But I'm a family be. They understand sometimes how just so you don't stir up issues within the people, take it somewhere else, go and do your thing before you come. But this, forgive my friend again, idiot of a neighbor I have is in his room and he is smoking.
Christian, make it snappy.
Yes. And it's not just disturbing me, but the neighbors on that chain. I have my plans for him. I have used channels to get to him. he's trying to turn the tables around and make it look like I'm lying. She ain't plans Harley. What I want to end by saying is we grew up on Akoda Okohen. We grew up on some of these interactive things that filled our subconscious. We knew not to take those things. Like what our brother from NDPC said, that even the taboo, the morals we had within our communities now fading away. Things we used to have that prevented people from just going to pick a normal stick to smoke. But right now, it looks like those things are fading away. E-cigarettes, please, GRA, let's even forget taxing e-cigarettes. Let's ban that thing. Me, I'll say it and I'll say it again. Tobacco is dangerous. I've been to the hospital this year because of that. So
All right.
please,
Chris,
let's find creative means.
yeah, when advocates who are passionate
to
get the
educate
opportunity,
so that we can turn
they will not
things
support
around.
their heart out. Thank you, Chris.
Thank you.
Thank you so much. And I've just been prompted. Video I saw Ad Adams hand up, but sorry, please, we are okay. I hope you can be brief because the one who is supposed to lunch is going out for another meeting. If we can, so you share yours. If yes, after. Please make it brief so that we can.
Okay, thank you very much, and thank you, Vast Ghana, for the good work that you're doing. First of all, I'd like to comment about the e-cigarette. Last year, the International Narcotics Control Board, through its projects, Global Rapid Interdiction of Dangerous Substances, we organized an operation called Operation E-Vapor all over the world. And the seizures that were reported were very staggering, such that the e-cigarettes are now being laced with synthetic cannabinoids, so synthetic THCs and all that. And the numbers, we did it over a period of 8 months. And the seizures, the numbers were very huge. And so then I will encourage the enforcement and regulatory agencies in Ghana that when we seize our e-cigarettes, let's take them to the lab and see what are the composition of the e-cigarettes that are coming into our country. Then the issue of public health also comes in with the e-cigarette. And so it's a very good point that it can never be overemphasized. It's now becoming an issue, a global issue.
Yeah.
Thank you very much.
Thank you too. You're welcome. Let's have the last one from Adams, and then we'll launch the.
Okay, so Mr. Masawudu, sir, I was touching on that issue regarding the ranking, and in fact, for a point of correction, I was not saying that we are not doing well. I know the sort of effort that you and others have put into that to get to that level. But what I was saying is that we shouldn't slumber on that ranking. You know, Ghana, as I could be or yadi or classroom or so, or to one will be a bit. I mean, we should put more effort into that. So, of course, we will actually reach a level whereby, of course, others too will learn from Ghana. I know what FAST is doing through your leadership and other, of course, partners. So, it's just a compliment to say that we should work towards to improve upon our current ranking. Thank you.
Thank you very much.
The minority group in this room, if you don't give it to me, I won't keep quiet. You see, all these things that we are discussing here, it's in English, big jargons. Me, I always come and say this thing. At the back of influencing social media to reach out to people like the movie we watch. Let me the bluff for Jinak Blalema, many about. And we want to reach the hard to reach community and the people that are really affected by tobacco. Yes, the elite are there, but when you go to the non-literate, we have the mass majority of them being impacted. Why are you in a couple of no? Well, let's look at how we are going to reach people in the different mediums and languages that we can reach them for we to be able to target the rightful people.
All right, so let me welcome LeBron and to share some few thoughts, and then welcome Dr. Combat to launch the report.
So Dr. Combat, please briefly, so that you will get. So let me just attempt to. I'll defer some of the questions Dr. Combat to answer because some of them obviously is beyond my reach. For instance, the issue around it says the duty free, right? And whether it's only Ghana that allow for this, or other countries to do that. So maybe, Bakambat, when you come, you can touch on that. Yes. So, but let me say that the issue about the e-cigarettes and then the US something. See, the point is that yes, it's about data, and it could be true. I'm saying it could be true because if US has a prevalence of smoking, let's say about 60, right, and they've not introduced e-cigarettes, and said, okay, fine, now stop smoking the traditional cigarette and now use this one so that then, because see, we have over 7,000 chemicals in a stick of cigarettes, right? So yeah, so if somebody has been able to produce something, so okay, fine, so now this one has been 7,000 now, okay, so this one will now about have 5%. The point that it won't take the effect away. The harm will still be there. But if they won't even tell you that they'll tell there's no harm. But what we are saying that there's a harm. But the harm would maybe they'll say it's reduced harm. Let's say they said harm reduction. So you are taking so much now. You want to reduce your harm, but that's not taking away the harm. So is that what we want, or we want complete? Taking away of the harm completely. So, but the point here in Ghana, our challenge here is that already the youth are not using it, and you are pushing it to them by advertisement, and they're not smoking it, or they're not using the e-cigarette, and that's what our challenge is. So because the prevalence is very low, people are not smoking the traditional cigarette in any event. Now you are bringing the e-cigarette to target who? The idea is to get the young ones who are already not even smoking, and that's what we are currently having in Ghana and many parts of the African country. They've not even smoked the cigarette before. To even say that their harm is high, to bring their harm with us. So the point is that, so normally I don't want us to talk about Western countries. No, let them deal with their problems. Africa and in Ghana, our prevalence is very low. How did we get to there? How did we get there? We got there by effectively implementing the WHO FCTC, which we signed on in 2003, 2004, and we've been implementing it today. So let's take to it, and then let's continue to reduce the harm. We don't want any harm reduction. So to hell with their harm reduction, right? So that's the response I want to give to Jashon. And I don't know why these people will not come into my inbox and ask me those, because I'm all over the place. Anyway. That's that maybe we can talk about that later now. Now, so civil society, what's his name, Chris? Yeah, we'll see how best we can work with civil society going forward. Now, on the narcotics, and I think that one, I think we have to work closely with GI, because GI also confiscate a lot of these products. And I agree with you. Can we check the toxic, what is inside? At least this is about research, because we are saying that information has done so many research to show that this product still contains some toxic chemical. It affects the brain. It affects the developing of our children. So we don't need it. But the point is that can we do further work in Ghana? These are prosecuted in Ghana. Can the FDA take the laboratory so we can have our own evidence to prove that indeed this product is not good and they are not, worth it to be? So we can declare it as a deadly product, which ought not to be in the system. But I'm happy about what you mentioned, the fact that we will definitely want to be involved in this global, thing to reduce, the use of vape, amongst our children. Now, please, not to come back again. Just allow me to do this one briefly. Somebody was asking their way forward, and the way forward for us is that we are going to roll out some engagement with policymakers. This is we are going to go to them in their various offices to discuss, the findings with them and see how they can accept some of this. We're also trying to just do some media outreaches. Go to the media house to do some media outreaches on this particular report, and then also have some infographics and others. So these are things that we have planned to do. But let me tell you that we have a tour, program for the year for tobacco control, which I know that with time we'll be inviting you to some of these meetings so that together we can see how we can implement some of these interventions, because it's about us, it's about our children. If we don't act now, trust me, we live, to regret. Our children will be asking us so many questions. Thank you very much for your attention. On this note, I'd like to invite, please do clap. On this note, I'd like to invite, in fact, my friend, my senior, Dr. Combat, who has been so grateful. So, in fact, it's a household name. He doesn't introduction, but let me say that he's been very tremendous, in the support of the civil society work in the way that we do, and he's one of the main reasons why we are advancing excise taxes in Ghana. Trust me, I mean the connection that's able to do between taxes and public health, you have no idea. So on this note, I would like to call Dr. Combat to come and give us, sit in to give us the keynote address, or maybe a short statement, and then help us officially launch the report. Thank you very much.
Thank you very much, the Executive Secretary of VAST. Yeah, just to take care of a few of your questions. So, in terms of the diplomatic missions not paying taxes on some of the items that they bring into the country, please, this is an international convention. Okay. Yes, it is an acceptable norm worldwide. So Ghanaian mission in US, they are also exempted from bringing in goods. So it is acceptable practice worldwide. So it's not only Ghana. Okay. Now, sometimes some of these agreements, they go contrary to what we want, but there's nothing you can do. You wouldn't believe this, that Ghana does not produce tobacco, right? And I'll say about 80% of the tobacco comes from Nigeria, right? But you wouldn't believe this. ECOWAS has an agreement that any product produced within the sub-region should not attract tax. So what it means is that even the excise taxes we have on the tobacco, the import duties, all the taxes we have on tobacco, when they are coming from Nigeria, it's free. What can you do? These are international agreements, so there's nothing you can do. They are deadly. Yeah, but we are talking about they are talking about promoting local or the sub-regional production. I hope you're getting it. So despite that the product is harmful, it is produced within the sub-region, and it is increasing output of the sub-region, creating jobs for the sub-region. And so they have agreed that all taxes on tobacco should be exempted. There's nothing you can do. So these are some of the problems that we face when it comes to the fight against tobacco, illicit tobacco importation. And then I think there was a question on the e-cigarettes, right? The e-cigarettes is a problem. Until we say we are banning importation of cigarettes. Okay, until we say we are banning importation of cigarettes, it becomes difficult for us to say, okay, these products should not come in. He talked about a law that we have, but you'll be surprised. We ourselves have registered entities to import the traditional cigarettes. Is that not it? Yes, we have done that. International trade. We say we cannot ban importation of cigarettes. You cannot do it. International trade is difficult. Only a few countries have been able to do that. Worldwide, it is difficult to say I have banned completely importation of tobacco into the country. So we ourselves register entities to import the tobacco. Is that not it? These same entities, when they are importing the traditional tobacco, they add the e-cigarettes. And GRA will not sit down for them to be bringing in the traditional products plus the electronic ones, and then without tax. That is the problem. And they are on our markets. So what do we do? Do we leave them? So that is the problem. So FDA has written officially to GRA to see how we can look at the laws, because their law says you shouldn't come in. Our law says we can tax them. So they've written officially to GRA, and I'm doing the follow-up. So what will happen is we have to meet and see what we can do. Minister of Finance, Dr. Tuforson, has written officially to Commissioner General for us to review uh, the Excise Duty Act, that is the 878. So we are currently at Mensvik to review it. He wants us to review the whole thing. So what will happen is, if we agree that we should not tax it, it will appear in that likely the mid-year budget. So what it means is that e-cigarettes will no more be taxed. That is what is going to happen. But for now, the registered entities are importing them, and we have to tax. We have to tax the product. Is there any other question that I have to answer? And then I also liked. Okay, you can. Yes, please. Yeah, it's not a problem at all. They are in our system, and we are able to track them. That is why we are even able to tax them. Yes, because it is FDA that registers them, and FDA is part of the ICANS. I hope you're getting it. So all the registered entities to import the tobacco, they are in our system, and FDA also has that information. So we are doing the work together. But they are saying, I mean, when they bring in the e-cigarette, we should not tax it. And they are bringing in the traditional ones, we are taxing them. And then you say the e-cigarette, we shouldn't tax that. That is where the problem is. So you should understand GRA. So we are working on it. We hope that we'll come to a compromise, an agreement, and then whether to tax the product or not to tax it. Are we fine? And then the introduction of the mixed tax regime, the ad valorem and then the specific, is actually bringing in a lot of revenue. Because prior to the implementation, we had collected about 176 million, but now tobacco alone, we are talking about close to 500 million. So I was thinking that is how your advocacy should gear towards. That part of the funds should be used to support tobacco control programs, like what you talked about. So I've just given you the hint that we are earning a lot from the mixed regime. And because of that, it has been a guide for us at Mensvik. So we are likely to introduce the mixed regime on other products very soon. And Mr. Labram, your issue about indexing the specific, to inflation, that has also been taken into consideration. So when we get approval from the minister, what it means is that anytime, prices go up, high inflation, we automatically adjust the rate of the specific. So it is being considered. It is being considered, and we hope that it will come to fruition. Okay, so I've just been called to launch this.
Second, but before you do that,
Yeah.
we'll have to have a team behind you. Very important. So, Mr. Labram, Mr. Jeff kindly join us here because we're part of the team that work on the report. Godfred, Mr. Adams, the Spider Chama, Mr. George, let's have you and Baba kindly join us for the lunch.
Okay, Miss Yoso.
Yeah, MOH, sorry. MOH. George, kindly alert the MOH, madam, to join you. And then narcotics control as well. Let me take this. Where's it? Please come to the middle.
Okay, so just yeah, so just want to say this that tobacco industry interference when it comes to tobacco control is a nuisance, and we all do not like it. But it has always been difficult for us to know where we are in terms of this interference. Unfortunately, we have a study like this that actually guides us. Is that not it? For us to know where we are and what we can do in this regard. Is that not it? So I actually want to commend VAST for this big initiative, and then for the study as well. I think they really deserve round of applause before we actually. So this is going to be a guide in terms of their operations, and I know a lot of institutions are going to actually use this study like a holy Bible to them as a guide. And GRA, I'm picking a copy and I'll send a copy to our Commissioner General, and it's going to be a guide for us. So on this note, I want to say officially launch the Ghana Tobacco Industry Interference Index 2025. It is officially launched.
Okay.
Maybe if you say we can action, we can function. We can function.
All right, so can you have a group photograph? Everybody, let's join. Some can be matter of an you know what?
So let's please raise it up a bit so that they can get a picture.
Chris. Tina, if you can go and say you can come there.
No, you can come here. Just pull this a bit. And then you can come. Please come. Good. Do you have a copy? Okay. Yes.
And capture MOE. And 65.3. You have to implement.
Interference. No more interference.
No more interference.
Yeah.
Thank you very much, Mr. Gamo. Thank you so much.
Carry yourself. Okay. I got it.
So,
The Gen Z way. What's your phone? Your phone me. Yeah. Don't worry, the spider will capture everything. Spider men are here, so don't fear. All right, thank you very much. Thank you, thank you.
Can I get a copy for us?
Yeah. So thank you so much. All right. So to help us with a closing prayer, our own advocate Mata Kofi. Yeah. I hope I can also get Gamia Lumini. Okay. Over advocacy now.
Yɛfa no ɛnyɛ a na wɔsɔre a. So at Vast Ghana, we want to take the privilege to thank all our partners for coming to grace this very important milestone in the life of our organization and that of our country, for taking the initiative to want to curb the manners of tobacco and its industry interference in policy that protects public health. Thank you, partners, and thank you, key initiators of this program. We want to say thank you to our international regional partners and founders. We say God bless you, and then we'll continue to work hard as much as you have our backs to help us to carry on the good work in order for us to be able to achieve the implementation of Articles 5.3. Yeah, 5.3. Thank you so much. This is not the end of the road. We'll still be engaging more, and I wish you all of you a safe journey back to your various destinations. Thank you. Now, please, shall we be in the mood of prayer? What check I want you more, what you are done, Bomoni, Unya, or Hiani, Okeoba. One no fian over Fay, BFA, Umani, Nincho, what Bekuna. She jo here more what she or back was and wire. One be Boni, who call here will work off Virginia, Abacha, or no how. There were fair I share a twin jolly. What warming was it near you running about what you more can nearly eke he wale. Look Billy Ben, one yan in Chuman and Oka over dear. What you bona fellow man be in Gigana. When you were you were, Kaja, Belfonji. Nick and me be Fonji Bani, a bow of Gomotrena. Well, Yakane, Obafi, Ogbina, yes, Subami, Amen.
Ganyo video and calling. Thank you so much. All right.
Yes, yes, I can hear you. I'm here. Thank you.
One organization has a statement from, some going to make a statement from NDPC.